Welcome to Disease-Specific Nutritional Solutions. And this presentation is going to inform you how nutrition can be utilized, not just to prevent disease from occurring later on in life, but actually to be used therapeutically for diseases and problems you may already have. And the effectiveness of nutrition, making it more effective than conventional medications that doctors traditionally give. So let's start and recognize that the major problems in America, the major disease problems people have, are they have high cholesterol, they're overweight, and they have high blood pressure. So being overweight, having high cholesterol, and having high blood pressure, that increased, if you have those three characteristics, that increased healthcare costs more than 3 times higher, 3 times as high a person than the average costs, which are high enough to begin with. So what about having high cholesterol? What about being overweight? What about having high blood pressure? Most people think that's the inevitable consequence of just living, and you know what? It is the inevitable consequence of living in America. It is the inevitable consequence if you're living on an American diet, but it simply doesn't have to be. Heart disease, high blood pressure, diabetes are preventable. You don't have to ever get them, and if you have them already, they're reversible. You don't have to have high blood pressure. You don't have to take medications for your high blood pressure. It'll come down through excellent nutritional choices. This is what this program is all about, how to lower your cholesterol, lower your blood pressure, and have the fat melt off your body effortlessly. Now, compelling data from multiple studies demonstrate that interventional studies, epidemiologic studies, these compelling studies show that a natural food diet that's rich in these superfoods, these plant foods, these nutrient-rich plant foods, has the effect to lower blood pressure, to lower cholesterol, to prevent and, yes, reverse heart disease. That means take away your chest pains. And in doing so, melt away the plaque that's there. And in doing so, take away your risk of having a future heart attack. Studies show that physicians utilizing these lifestyle modifications get results that are powerful, protecting people against having future heart attacks that conventional cardiac interventions like angioplasty and bypass surgery cannot achieve. They simply can't be achieved unless you change your health, unless you change your health habits. Excellent nutrition, and as described in my immunity solution here, where I'm telling you how to eat the high nutrient foods and eat less of the low nutrient foods, make that flip, is truly the fountain of youth. A plant-based diet where you're focusing on the most highest micronutrient-containing foods, vegetables, beans, mushrooms, onions, seeds, nuts, fruits, limiting or eliminating unhealthy foods like the processed foods and most of the animal products, allows your body to repair itself. And modern science substantiates this, that food choices are the major determinant of your health, the major determinant of the medical problems and medical tragedies that can befall your life, and the major determinant of the length of your life. So I've made it easy for you. I've given you the solution. I've done the homework, and I've put it into a program that you can apply in your life, right in your own kitchen. So here's the plate. The plate's divided up, obviously, into vegetables as the major contributor. It's based on vegetables, right? Vegetables, and the other part of the plate is relatively equally split between beans, fresh fruits, nuts and seeds, and whole grains. Right? A nice smattering of all the healthy plant foods in the whole forms. Processed foods, white flour products, white rice, oils, sugar, sweets, junk foods should be wiped out of your diet, or special occasions, or very small amounts on rare occasions. Those aren't foods that really existed in the natural environment. Those are created foods. They're fake foods. They're phony foods. They're disease-causing foods. Why would you intentionally put something harmful into your body? You only get one body in this life. You don't get a new one when you destroy the one you have. You got to take good care of it. What's more important to you than not having some severe or potentially life-threatening medical tragedy or hurt your body in some way that could potentially be irreversible? So study this plate and follow it. And if you notice, these small segments of animal products show that you can use animal products, if you'd like, as a flavoring, as a condiment to make a dish taste better in small amounts, but it's not a major source of your caloric intake. It's a very minor source. And when you do it, you follow the program as the plate laid out, it works. Here's Charlotte. Charlotte weighed 260 pounds with severe diabetes, on insulin, and had a stroke, wheelchair confined. She found out about this program. She lost 130 pounds. That's right, she went from 260 to 130. She lost half her body weight. No longer diabetic, back to being mobile, out of the wheelchair, having a life again. And people like this, they're not only incredibly grateful, but they're also a little angry at the same time. They're angry that after all that suffering and after having strokes and heart attacks and stents and all these things, that nobody told them about this, that nobody told them they didn't have to go through all those medical problems before they had to learn about this. So, it's called like wake up and be grateful for the good life and your good health, but take care of it so you don't ever lose it. Diabetes, like Charlotte reversed her diabetes is reversible. And I obviously have seen hundreds of people reverse their diabetes. Here's a study that we published, put 10 consecutive cases together. And this was presented at the Academy of Nutrition and Aging in a conference in 2010. And all the patients got off their diabetic medications. The average hemoglobin A1C, which is a marker of their glucose level, averaged over a 3-month period, went from 7.7 to 5.7. That means it went from an average diabetic to a non-diabetic level. All the patients, most of them had high triglycerides, and that normalized. And their average blood pressure at the start on medication, which was elevated above 140, came back to normal on no medications. We're saying here that all these major factors, the major risks in America, overweight, high triglycerides, high cholesterol, high blood pressure, and diabetes, reverse in a relatively short period of time. I sometimes have medical students and other physicians follow me around in my practice to learn how we apply nutritional methods and how we motivate patients. Here's one physician in my practice one day who spent a week with me, and he said to me, I'm taking notes on the charts you're seeing today, and I figured out, and you saw 4 patients today that you saw 2 months ago. And out of these 4 patients, every one of these 4 patients that you saw today dropped their cholesterol 100 points. So here I'm showing you a slide with 4 patients that dropped their cholesterol. Their LDL cholesterol dropped significantly. Their total cholesterol dropped about 100 points, and their LDL cholesterol dropped somewhere in that range, between 70 and 100 points. Dramatic reductions in cholesterol. And these were patients that I saw in my office in just one day. Imagine how many people see dry their cholesterol in a year, in 10 years, in 20 years. The people who read this information and will learn about my information with public television, the thousands across the country are utilizing this and dropping their cholesterol, reversing their heart disease, saving their lives. And you know what? I think one of these patients, their cholesterol dropped that 100 points. They were on Zocor, a cholesterol-lowering drug, and stopped the drug, and their cholesterol still was 100 points lower. So we see dramatically results bordering on spectacular. Take Ronnie, for example. Ronnie had already had bypass surgery that clogged up again. And then they put 4 stents in. Within a couple of weeks, he had restenosis in the stents, and he clogged up again. He couldn't hardly breathe and couldn't even walk. He had to go home to bed. He weighed over 300 pounds. He was literally ready to die. He was dying, actually. He found out about this program. He dropped 140 pounds in 1 year. That's a lot of weight to lose in 1 year. He was motivated. Once you see that weight falling off you, like 15 to 20 pounds the first month, 10 pounds the second month, you're psyched. You know you're on the right track. Once you see yourself feeling better, your energy coming back, you get those blood tests back, you see that it's working for you, it's fixing, it's repairing, you're getting well. Ronnie got psyched. See, look at how trim and fit he got. He got it back in unbelievable shape. Now Ronnie doesn't not only has heart disease, he jogs, he plays tennis, he lifts weights. He's physically active. He's back to where he was 40 years ago in his youth. He got his life back. He's a living, walking example to other people of what can be accomplished. And he motivates other people to make changes in their life. It's a victory, and it saved his life in the process. Take a look at the statistics here. Take a look at this. His weight was over 300, went to 160. His blood pressure on medication couldn't be controlled. Now is 115/70, just 1 year later on no medication. 1 year later, we lost 20 inches off his waist in 1 year. His cholesterol on cholesterol-lowering drugs went from 228 right? To 132 on no medications. His triglycerides dropped from almost 312 to 68, and his LDL cholesterol went from 148 on cholesterol-lowering drugs to 75 on no medications. So the point here is no matter where you are, even people like Ronnie, even people who are in bad condition, they have hope. And autoimmune diseases also, you should have hope. A lot of people are able to get well through autoimmune diseases. Diseases like lupus and multiple sclerosis and scleroderma and Sjogren's syndromes and Crohn's disease and colitis and psoriasis. And autoimmune illness is now the 4th leading cause of disability in America. 75% of people with autoimmune diseases are women. And there are 80 other autoimmune diseases besides lupus, psoriasis, and rheumatoid arthritis. There's lots of these autoimmune diseases that people get. But the earlier you catch them, the more potentially reversible they are. Don't wait. The point is to get and start this program when you just first get diagnosed. Better yet, start the program before you even get an autoimmune disease. Don't wait till you damage part of your body. It's a serious illness. People die from this. Look at the slide. It shows that lupus incidence, that means that people getting lupus, went up. It increased 5-fold over the last 50 years. These diseases are related to the poor nutritional practices we have in America today. Then it's not genetic. Most researchers today believe that these increases in autoimmune diseases are related to environmental and dietary changes in America in the last 50 years. We're a processed food nation. We're a fast food nation. Genetic defects control susceptibility. Our genetics have predisposed us to lots of different problems, but those problems would never have the chance to be expressed if we didn't first stress the body out with poor nutrition. We have to eat right. It's well accepted now in the scientific literature that the main causes of autoimmunity is not in genetics, it's oxidative stress. Oxidative stress means inflammation due to free radical activity. Increased free radical, fatty acid imbalances, bacterial challenges, microbes, of course, that your body can't control because of bad nutrition, vitamin D deficiency, an excess caloric environment, too many calories, which excite the immune system to overreact. All these things are the reasons why people get autoimmune disease. They did a study on mice who had thrombocytopenia reversed and survival increased when they calorically restricted them and gave them proper nutrients. The secret here is to get the nutrients in an environment of an adequate amount of calories, but no excess calories. Excess calories and excess body fat fuels excess activity of your immune system, and you can't turn it off. We want nutrients, not calories. That only can be achieved by eating a diet style that are high in micronutrients, a diet style high in micronutrients. And that means you have to eat foods that are high in micronutrients and naturally low in calories. And that means vegetables. When you eat a vegetable-rich diet with less calories and increased nutrients, it increases the function of the T suppressor cells. And the T suppressor cells are the cells that control the immune response. It shuts it off from overreacting to any stimuli. It's the defect in T suppressor cell function from poor nutrition, from low nutrient, high calorie intake, that is at the foundation of autoimmune disease. So this is really key. These nutrients control immune cell function. The T cells, the lymphocytes that are produced in the bone marrow, they're exquisitely sensitive to specific nutrients and specific foods. We get defects in T cell functions, specifically the T suppressor cells that dampen down their activity. They almost become paralyzed, and they can't balance the immune function. As with checks and balances, we signal immune activity, and we have to shut it off. We signal it, we have to shut it off and control it. And the body signals it improperly and can't control it once it's signaled. It just gets uncontrollable and starts attacking the human body and not differentiating our external things that we're fighting from the external environment, like microbes or defects in our own cells that are abnormal, and it starts attacking normal cells. So these defects in decreased amount and function of T suppressor cells are reported in all types of autoimmune illnesses, and is foundational to repair this is to fix the activity of those cells. And how do we fix the activity of those cells? We fix it by feeding them these green cruciferous vegetables. It's key. because the cell function, the immune system function, is dependent on the isothiocyanates, the ITCs, from green vegetables. You need a plant-based diet. You need lots of vegetables. You need vitamin D adequacy. You need the beneficial fatty acids for a proper immune system function. That's especially EPA and DHA, to have them present in the diet. And a review of the literature on nutritional application for people with autoimmune disease shows that dietary manipulation provides a means by which patients can regain control over their disease. And that's published in a medical study, in a review study in the medical literature, scientific studies. That was the conclusion of their study, that dietary manipulation does work. On the other hand, we know that drugs for autoimmune disease causes cancer. The autoimmune disease puts you at higher risk of cancer to begin with, because it reflects the fact that there's some DNA damage that could lead to cancer. And then the drugs make your risk of cancer ever so much worse. They tracked over 1,700 patients that were started on treatment by rheumatologists for 10 years, and they found a 400% increased rate of cancer in the treatment group in this 10-year period compared to the controls that weren't treated with these drugs. These chemotherapeutic agents that rheumatologists use are risky. So clearly, if there's a way you can get well without the drugs, wouldn't you think it would make sense to use dietary manipulation first? So let's review. If you have an autoimmune disease, like rheumatoid arthritis, like psoriasis, want a high nutrient diet, rich in green vegetables, vegetable-based, using blended salads and smoothies to increase the consumption of these nutrient-rich foods. You may want to drink a glass of vegetable juice to bring your levels of these nutrients up, with beets and parsley and kale and carrots. High-dose EPA and DHA, because the high-dose omega-3 fatty acids have an immunomodulating effect to lower the overactive immune system. We want to give you beneficial bowel flora, the probiotics, because giving you probiotics can help prevent antigens, stimulants from food, from exciting an immune response. And it can help normalize the immune response, because very often the destructive of bacteria in the digestive tract could be a weakening factor in immune system abnormality. We want you to take vitamins and supplements with no folic acid or vitamin A. We want to make sure you have adequate vitamin D, of course. And the dietary avoidance of wheat, usually gluten can play a role, and salt and oils. We don't want to take in foods like oils that stimulate inflammation or that rapidly put fat on your body. We want to get the fat off your body. Now, the Lupus Foundation of America came out with a statement about diet, and this is what they said. They said, let me read this, advocating an excess or an exclusion of certain types of foods are much more likely to be detrimental than beneficial in any disease, including lupus. Amazing, isn't it? The statement from the Lupus Society just said that diet doesn't play a role, doesn't help at all, and it not only doesn't help for lupus, it doesn't help for any disease. That's what they said, in spite of the fact that medical studies show that it does work. And I'm showing 2 medical studies from, of course, the Journal of Rheumatology and the Journal of Review of Nutrition, where they analyze and put together, pool the meta-analysis of studies done showing it is effective. So it's not just myself and my patients, it's what the medical literature does show, denied by common medical authorities. There's a bias, obviously, towards using these medications. Here's an example of Susan, who had lupus, and here's what she said to tell you. I was on methotrexate, Oroville, Voltaren, and prednisone. Each drug had a different side effect, and with all of this, I was still not getting better. Yet, in just a few short months, your nutritional program not only eliminated my pain, my blood pressure went down, I lost 60 pounds, and I remained healthy. I would like to thank you from the bottom of my heart. I feel great. I owe it all to you. I can't thank you enough. Isn't that heartwarming, all these people getting well? And they're thanking me, but it's not really me. It's just the fact that they've been, how should I say it, misinformed, miseducated, lied to maybe. They haven't been given the right information. People have a right to know this information. They shouldn't have to be getting it from a one lone voice yelling from the wilderness here. They should know this their whole life. The most important thing they could have learned when they went to elementary school, that how excellent nutrition was critical for them to have a happy, pleasurable, and disease-free life. Let me read you another letter from Cheryl. I had lupus for 20 years. I took Plaquenil, methotrexate, prednisone, and other toxic drugs in high dosages and still lived my life imprisoned in isolation and pain with many lost years. I searched for years looking for something else. Over the years, I'd done acupuncture, chiropractic, massage, exercise, stress management, vitamins, herbs, fish oil, antibiotics, and other treatments. I'm so grateful to have found Dr. Fuhrman's Immunity Solution. Thanks to him, today I have a normal life, full of energy, the joint pain is gone, and I'm on no medications. Incredible, right? What's incredible is that people don't know about this. It's incredible that the Lupus Foundation is still claiming that nutrition has no role to play in this. You know, it's so funny, sometimes really crazy things happen, like with Deborah. Let me tell you what happened with Deborah. She had lupus too, and she had discoid lupus on her skin. Let me read you what she wrote. I couldn't believe I felt so good so fast. Within 1 month, the discoid lupus cleared, the skin rash had disappeared, my joint pain and stiffness had disappeared too, and I looked and felt radiant. Everyone commented how good I looked. My skin looked soft and smooth. I was well again. I went back to my rheumatologist, excited to share my story. He became irate and screamed at me. Ridiculous nonsense, he said, and told me to get out of his office. She actually came back to me crying that the rheumatologist was yelled at her and wasn't nice. And I said, what are you crying about? What are you upset about? You're the person who got well. He's got the problem, not you. You should be happy. You know, it's sad that he's not going to benefit from this. It's sad that he's not going to utilize this, but be thrilled that you took care of your health. And that's what you have to do. All of America isn't on board, but you've got to be on board. It's your life. No matter how many people know or don't know, we know, right, that the right thing to do is you can't get good health without good nutrition. The American Academy of Dermatology says that scientific studies have not found a connection between diet and acne. Not a connection. In other words, food does not cause acne. Not chocolate, not French fries, not pizza. This is their statement. Can you believe it? Amazing. What do the studies show? Let's go to the videotape, as they say, right? The videotape shows the studies do show that acne is helped and even cured, even wiped away with good nutrition. Number one, we find in medical studies that the sex hormones in dairy products, that drinking milk increases acne lesions. That high glycemic foods, the high insulin level, is linked to increased IGF-1, decreased immunity, and increased acne. IGF-1 promotes acne. And IGF-1 is raised by a high concentration of animal protein, a lot of animal products, and by sugar too. So IGF-1 increases skin inflammation, doesn't just cause increased risk of cancer. And dietary antioxidants and phytochemicals are protective. And of course, I've been doing this for not 2 or 3 years, but for more than 20 years. And people, and even teenagers or people who have severe acne, even where the antibiotics and the skin and the lotions don't work, are able to get well. This is an answer for them. Take Caitlin. She was a young woman, 13 years old, teenager actually, who had H. pylori and stomach problems that didn't respond to antibiotics. And she had severe acne. So I told her, we have to attack this nutritionally. Not just be put on antibiotics. They give, because dermatologists will sometimes put people on antibiotics and leave them on them for years. They don't even know that antibiotics increase the risk of breast cancer and other cancers. So her parents understood this. She understood this. She didn't want to be on drugs the rest of for years. Within 2 months, her face cleared. No more stomach upset. Her severe acne is gone. I see lots of unusual cases that are nutritionally, where the etiology is nutrition. I saw this person. He went to 3 separate gastroenterologists because he had severe vomiting that was unrelenting for 2 years. Just vomiting and vomiting almost everything he ate. Very, very thin, too thin because he couldn't digest the food. His stomach would throw up everything. And the first doctor recommended Botox injections to help relax the sphincter, to stop the sphincter from causing him to vomit. Went to another doctor, didn't like that idea. Another doctor recommended implantation of electronic device, surgical implantation to reduce dumping or to spasm. And then he went to another doctor who wanted him to take a very dangerous drug which can cause permanent brain damage to help relax. He was given one option after another. So I saw him, I looked at his diet. I did a blood test, a test for nutrients. And believe it or not, I found him to be severely vitamin D deficient, where his level was only 7. The normal range is between 30 and 50, and his level was 7. And I treated him with vitamin D and within 2 weeks his problem resolved. He was for years running from doctor to doctor. Sometimes, the point I'm making is sometimes simple nutritional changes are the most effective thing you can make. And you've got to take charge of that. You can't expect anybody else to do it for you, because sometimes doctors will miss this, that optimal nutrition and superior nutrition is the key, the foundation to good health. What does the textbooks, the medical textbooks say? I'm reading this, quoting this directly from a medical textbook now. And this is a textbook that's been around since I was in medical school about 30 years ago. Here it is. The inflammatory response is closely intertwined with the process of repair. Inflammation serves to destroy, dilute, or wall off the injurious agent, but in turn sets into motion a complex series of events that, as far as possible, heal and reconstitute the damaged tissue. Wow, that was a lot of words. And it was hard to imagine what was just said, but that's so very poetic, isn't it? That book was so beautifully written that most medical students read in the first year of medical school. The basis, the pathologic basis of disease, they learn that the body gets inflamed in response to some toxic agents in an attempt to repair itself or remove the injurious agents. It says right there, we learn the basis of pathology is the body is a self-healing, self-repairing machine looking to fix damages that are exposures from the external world. When you get a headache, that's the body working to remove some kind of irritant in the brain. When you get a skin rash, it's the body to throw out some poisons from within the body that you were exposed to. When you get a cough or a runny nose, you're producing mucus to wash away the virus particles or to wash away or something that you were exposed to, like you breathe in smoke, you cough to get it out. The body is vigorously trying to defend itself, and this is what this statement says. It says that as far as possible, the body's trying to heal itself, trying to repair damage. And you know, this is what headaches is all about. And people go to doctors with headaches, and they feel ill, and a doctor gives them a drug to stop the headache. The headache was the treatment. The headache was the body trying to mobilize the toxins for removal. And you felt uncomfortable when the toxins were being circulated in the bloodstream so the body can get it out. So we take medications like Esket, Vanquish, Furanol, Furacet, Midrin, Excedrin. We take these medications whose active ingredients are barbiturates, narcotics, and caffeine to suppress headaches. So what do you think happens? Even Tylenol, even an aspirin. We take these medications, it pushes the toxins back in, so you get a headache again 2 days later or 5 days later. It doesn't allow the body to remove the cause. The cause is get rid of the toxins in your body, get rid of the free radical excess inflammation, the oxidative stress, replenish the body with the nutrients it needs, allow the body to remove the inflammation, and the headaches and the severe migraines melt away. Take Renee, for example. At age 15, I saw Renee in my office. She was mostly in bed for the last 3 years. She missed 3 years of schooling, had to be homeschooled. She was too fatigued to get out of bed. She was hospitalized in 3 separate hospitals, seeing the best headache specialists in the world. In Brigham Young and Johns Hopkins. They even tried intravenous experimental drugs trying to break her severe headaches. She's been to so many doctors. She comes to me. She didn't expect to get well. And she was, frankly, from the problems not going away, she was even depressed. And I don't think she believed that I could help her. And after a month, she wasn't even better. But after 3 months, the nutrient richness of the diet was measurable in her tissues. And her headaches, after months, she started to improve a little bit, but after 3 months, she made a complete recovery. Back in school again, on the school track team, was running for school president, went to an excellent college. Renee got her life back after 3 years. Can you imagine? There are people all over the country suffering with severe conditions like Renee. Headaches every day where they can't focus, can't go to work, can't go to school, all because of poor nutrition. So the migraine tips: flood your body with nutrients. Allow your body to detoxify. Have a glass of vegetable juice to increase the nutrients in your tissues. Have a salad with a nutter seed-based dressing to absorb those nutrients. Chew very well. Make those big soups with cruciferous vegetables and beans and mushrooms. Again, use a low dose of EPA-DHA supplementation to reduce inflammation in the brain. And you have to wean off medications, because the medications are one of those toxins that keeps the headaches fueled and going on and on. You have to get off medications and caffeine, and you have to wean off slowly. You have to avoid triggers like salt, like MSG, yeast, dairy, baked goods, processed goods have AGEs, advanced glycation end products in them. No pretzels, potato chips, and fried foods and French fries. You've got to get on a healthy, natural foods, and the migraines melt away in almost every case. You know, a lot of people in this country are suffering from depression too. And they don't see depression as being largely nutritional. It is. It's largely nutritional and also environmental. It has to do with living indoors and not getting exposed to light. And we're overly reliant on drugs. Just published in the New England Journal of Medicine, they did a review where they reviewed 74 different studies. And what they found, and they were so careful in doing this review, they tried to get the studies the drug companies did that were not published. And they found that they didn't publish the negative outcome studies. But they looked at all the data in an unbiased manner. When the studies that considered, you know, all the studies done, even the ones that were not published, they found that the antidepressants just did a little better than placebo. They have very minor effects to help people. I'm not saying they're not helpful and can't help people in some cases, but the point is they don't do that much, and in many cases they don't help people at all. And because we're not addressing the cause. And light therapy, where they expose people to bright light, preferably in the morning, between 7 and 8 o'clock in the morning, because look, in the morning, when you wake up, the bright light stops the melatonin secretion. And when the melatonin secretion is stopped by bright light, that allows the body to produce serotonin. When you're living indoors and you wake up in the morning and you stay in indoor lighting, the lighting's not bright enough, and that allows melatonin secretion to continue to be produced by the body during daylight hours. And that inhibits the production of serotonin, and it promotes depression, especially in women. You know, when you go to bed in a dark room, in a very dark room, it allows melatonin to be produced to the most optimal level. And that melatonin you produce at night in a dark room protects you against cancer. People who sleep at night with lights on, or even with a TV running or a light, those lights can be sensed through the closed eyes, even while you're sleeping, and that can inhibit melatonin secretion, increasing your risk of breast cancer. You want to sleep in a dark room if possible. And then you want to expose yourself to lots of light when you wake up. That'll consolidate the melatonin, making at night you get the maximum melatonin production, and you don't want to secrete melatonin during the day. You want it to stop secreting. So that's why the studies show that when we expose people to depression, to this very bright light therapy, first when they wake up, it consolidates the melatonin at night, it allows them to get better sleep when they're sleeping at night, and allows them to produce the serotonin during the day. And then they don't require the serotonin uptake inhibitor drugs, the antidepressant drugs, because light therapy works better than the drugs do. And you know what? You mix that with exercise, and you mix that with good nutrition, and you mix that with an EPA supplementation, because the EPA supplementation, that's the part of the fish oil, or the part, you can get that in a vegan source now, that's a part of the omega-3 fatty acid that is shown to benefit depression the most. With no processed foods, no dairy products and trans fats, what do you think happens? People get well, and they get well more effectively than taking drugs. When you're just taking the drug, you're not addressing all the other potential causes. We're not even considering the stress and the, an environmental and emotional causes of depression. But people who live, closer to the equator, they have wars and they have stress and they have poverty and hard things in their life, and they don't get as much depression as people who are more affluent and have less stresses in their life, who live in the northern climates that don't have exposed to light. The point here is that you have to address all these potential causes when we're trying to fix disease. And when we do, we address the light problem, the nutrition problem, the fatty acid problem, your life becomes easier, and you're most likely going to achieve a faster and more dependable recovery. Take James, a young man at 27, severely depressed, and insomnia. And depression can go together. It can go with hypersomnia. In other words, depression can go with a person who can't stop sleeping, and because your whole hormonal axis is thrown off, or it can go along with people who can't sleep well. And here's James, who couldn't sleep well at night, and of course he was depressed. After 2 weeks on light therapy with a high nutrient diet, his symptoms improved. 2 weeks. After 2 months, he was all better. He went back to work full-time as an accountant, and in 4 months, he was sleeping through the night, sleeping well with no insomnia at all. Took him some time, but the point is, it's never the wrong time to have good nutrition. It's never the wrong time to put your life back in with proper lifestyle habits. Lifestyle medicine is the proper type of medicine to have. Nutritional excellence protects and treats all diseases. And it's the same basic treatment, because here's the thing. It's not that there's a certain diet style that's going to fix your heart, and another one's going to be good for autoimmune disease, and a third, completely different diet is going to be good to protect you against cancer. No, it's not that at all. It's that the same protocol, the same superfoods that protect you against cancer melt away your heart disease. The same superfoods that protect you against cancer help reverse your autoimmune disease. The same superfoods that protect against cancer help you lose weight and help you melt the fat off your body. The protocol here is when you're ill, when you have a medical problem you want to help get well from, we increase the exposure to these high micronutrients. We sometimes will use a glass of vegetable juice or a smoothie mixed in. We always want people to eat a nice salad every day and chew it really well. It's not sufficient just to have the juice or the smoothie. You also have to have a salad that you actually chew. You might use soups with carrot juice and tomato juice and cruciferous greens added. You put the greens in, you make the beans, you put the mushrooms in there. You put chopped or pureed onions in the soup. You have a serving of steamed green vegetables every night. That becomes the salad and the green vegetables become your main dish. You remove processed foods, junk food, cold cereals, sweets. Your sweetener is fresh fruit mostly. And you avoid white flour and dairy products. You supplement intelligently and wisely. With EPA and DHA, you fix any deficiencies you might have. And very often, you take a probiotic and vitamin D to assure vitamin D adequacy right in that sweet spot, not too high and not too low. And don't forget your G-bombs. G-bombs, greens, beans, onions, mushrooms, berries, and seeds. Great word to keep in your mind. You want to eat these regular superfoods all the time. I'm wishing you a long and pleasurable life. I know it can be yours. Bye for now. Welcome to Nutritional Science Can Save Your Life. The purpose of my presentation today is to give you information from the recent scientific literature that you can apply to your own life to make your life better, to make your life healthier, to make your life longer, to make your life happier. So let's get to work. We're going to take nutritional science and review some important basic information here today. First thing I want to discuss is my health equation, H equals N over C. That means your healthy life expectancy, that's the H, is proportional to the nutrient per calorie density of your diet all through life. That means the more high nutrient density foods you eat, these rich foods that are high in micronutrients, the longer you're going to live. And that means you want to avoid foods that have lots of calories that are not high in micronutrients or don't have micronutrients in them. We want to eat a diet style with a high micronutrient bang per caloric buck. Now this means not only just the high amount of these micronutrients, but the breadth, the broad variety of micronutrients. We're talking here about we extend human lifespan by achieving comprehensive micronutrient adequacy, and that means every peg is filled of every micronutrient we need. And you know what the most important micronutrient that you might need to extend your life? The important micronutrient you need to take to make sure you live longer? The most important one is the one you're missing. So we got to make sure you get all of them. That's the whole point here. Okay, so what I've done here is we've looked at studies, and we see that when people eat less, they live longer. And when animals are fed less food, their telomeres, that's a part of the cell that can shorten or lengthen or stay long, tells you how fast you're aging and how long you're going to live. And we find that animals that eat less calories, their telomeres stay longer. They don't shrink as they age. So we're slowing the aging process. When we eat less calories, we're reducing free radical activity. It suppresses genetic defects and genetic alterations. It inhibits the production of cross-linking agents and toxins in the cells. So the cell can keep itself clean, it can slow the aging process, and you can live longer and keep your youthful vigor when you consume less calories. But the secret to consuming less calories is not just willy-nilly trying to eat less food, it's getting back to eating foods rich in micronutrients. Because when you eat foods that are rich in micronutrients, then it naturally suppresses the appetite, where you're not going to want to eat as much. So this is not about artificially trying to starve yourself. It's trying to eat more foods that have a high micronutrient per calorie density. And that's where my ANDI scores come in. The ANDI score, the word ANDI stands for Aggregate Nutrient Density Index. And here I've scored almost all foods that you might think of eating by looking at the total micronutrient content. I've taken almost every micronutrient that the government reports that are in foods, and I've added them all up per an equal caloric size portion of each food, so you can look and see, well, what foods are really high in micronutrients and what foods are really low in micronutrients per calorie. Because we want to eat more of those foods that are high in micronutrients, obviously, and less of the foods that are low in micronutrients. That's the secret here. And interestingly, foods like green vegetables aren't just twice as high as most foods Americans are eating, not just twice as high in micronutrients. They're not even 10 times as high. They're 50 times as high in micronutrients than the foods most Americans are eating. Because most Americans are eating processed foods like sugar and flour and animal products that don't contain many micronutrients, and they score very low on the ANDI scoring system. But keep in mind that even the nutrients those foods do have, they don't full of the anti-cancer nutrients, the nutrients that support a good immune system, the nutrients that extend your lifespan. Those micronutrients are heaviest in the G-BOMB foods. The G-BOMBs, G-B-O-M-B-S, greens, beans, onions, mushrooms, berries, and seeds. Those are the foods that score the highest. You need to eat lots of green vegetables and these other nutrient-rich foods. When you eat white flour, bread, pasta, breakfast bars, chips, soft drinks, pretzels, when you eat those foods, they don't just not give you nutrients, they actually create heart disease, make you demented later in life, and create cancer. They're not just not nutrient-rich, they're actually harmful. They're destructive to your future health. And the scientific studies bear this out. For example, studies show a remarkably increased risk from heart disease for those who eat refined grains like white flour and white rice. More than 15 studies show an increased risk of stomach cancer and colon cancer. More than 12 studies show eating white flour like bread and pasta increase the risk of breast cancer. These are significantly dangerous foods. Look at the studies on white rice and breast cancer. There's a study of Korean women showed that for every serving of white rice, they increase the risk of breast cancer about 20%. And every serving of wild rice or dark rice decreased the risk of breast cancer by about 20%. So these high glycemic foods are associated with breast cancers and other cancers now in multiple studies, and especially among overweight women, because when you're overweight, you have more insulin resistance, and the pancreas secretes more insulin in response to a high glycemic load. So we're trying to really make sure that people eat a diet style that's nutrient-rich, not excess carbohydrate, excess fat, and excess protein. We don't want to get excess calories. We want to make sure the diet overall has a low glycemic load. That means less sugar in the bloodstream and therefore less of an insulin response. So a meta-analysis, and the word meta-analysis means putting multiple studies together. This is 39 studies put together, show that glycemic load and glycemic index, which register the amount of sugar or glucose in the bloodstream from response to foods, are associated with increased risk of cancer, especially colorectal cancer. And about 10 studies put in a meta-analysis show that these high glycemic foods are associated with breast cancer as well. So we want to make sure we avoid these high glycemic foods. And of course, here's an example. White potato, white rice, white pasta, chocolate cake. Those are foods we shouldn't be eating much of because they have high glycemic load. Whereas we want to get our carbohydrates from peas and beans and cashews and watermelon and oranges. And, in other words, fruits, especially berries. Beans are a great source of carbohydrate. These foods are squashes, peas. These foods get you carbohydrates, but they give you plenty of nutrients in the process. And they also have a low glycemic load. They have that criteria: high in fiber, high in resistant starch, lower in calories. In other words, there are good carbs and there are bad carbs, and we want to get most of our carbohydrate intake from the good carbs. All right, moving on from carbohydrates to protein. Because just like excess carbohydrates can shorten your life, excess protein can powerfully shorten your life too. Because we've been brainwashed with this idea that more protein is better, and we should be trying to cut out carbs and eat more protein, and that gets people into more trouble. It's not cutting out carbs, it's eating the right carbs. But it is eating less protein and the right protein, because the right protein is more protein from plant matter. Because, broccoli, about 50% protein. Beans, about 25 to 30% protein. Grains, 15 to 20% protein. Nuts and seeds, 12 to 18% protein. We're saying here that natural plant foods do have adequate protein. When we get most of our protein from animal products, we get too much protein. And when we get too much protein, it raises a hormone called IGF-1. That's insulin-like growth factor 1. I'm saying here that excess protein shortens lifespan, increases aging, linked to dementia of the brain, and increases risk of cancer. See, what happened is they found that when they restricted the calories from animals, they lived 1.5 times longer than the animals that are allowed to eat all the calories they desired. And they looked at their blood and found out what hormones were changed that were linked to long lifespan. And they found that the most powerful hormone that predicted longer lifespan in the caloric-restricted animals was IGF-1. Then they put humans in the biosphere. They isolated humans and they restricted their caloric intake. And they thought they'd see the same changes that they saw in animals. And you know what happened? They didn't see the IGF-1 going down when they caloric restricted the humans. They said, oh my goodness, humans aren't going to get those lifespan benefits we see in animals. But they found out that the reason why the IGF-1 did not go down was because they were still eating 30% of calories from animal protein. It wasn't until they reduced the animal protein as a percent of calories and observed the IGF-1 levels in vegans that they were able to modify the diet style to achieve those hormonal levels that we see in the long-lived animals. So now we know, now we've done the studies, more research is coming out showing that the diet style that's too high in animal protein has a host of different detrimental effects to humans. Especially, we're talking here about a 28% increased risk in breast cancer, a 22% increase in prostate cancer, a 28 to 90% increased risk in colorectal cancer in the highest range of IGF-1 levels in the blood in meta-analysis. You don't want to have a high GF-1 level in your blood. You want to have those growth hormones, might be good when you're a baby or when you're growing, but when you're an adult, having hormones that promote growth of tissues, replication of cells that lead to tumors and cancers, something important to avoid. All right, so now moving on to my nutritarian food plate. So I've given you an idea, like a food pyramid years ago, the government changed to a plate, so I changed to a plate too, to make it easy for you to see the type of foods I want you to eat the most of. And what do you think I'm going to put in the bottom of my pyramid or in a major segment of my plate? I'm going to obviously put foods that I want you to eat a lot of, and you have to eat a lot of vegetables, especially green and other colorful vegetables. Should be almost half your diet. And you can see a big portion of that plate is vegetables of all types and of all color, particularly paying attention to those nutrient-rich vegetables, especially mushrooms and onions and greens, and of course orange carrots and, squashes. And then of course whole grains, beans, nuts and seeds, fresh fruit in approximately equal amount. Round out the rest of your diet. And then the foods we're eating lower amounts of are animal products and processed foods. And certain processed foods you want to avoid as much as possible. You want to avoid sweets. You want to avoid, fried foods. You want to avoid salty foods and junk food and desserts and things like that. And make great tasting natural desserts out of fruit. Make ice creams by whipping up frozen fruit with little nuts and seeds. We're going to show you incredibly delicious ways you can make the healthiest foods on the planet taste great. Now, I want you to keep in mind here that we're trying to lower animal products and lowering animal protein. In the process, you automatically lower saturated fat, because saturated fat is highest in meats and cheeses. And saturated fat are linked to higher rates of cancer and higher rates of heart attack. But not so much. Smaller increases, like 10 to 20% increase of heart attack is significant. Likewise, low fruit and vegetable intake are linked to higher rates of cancer and higher rates of heart attacks. But here's the point, is when you marry together the high saturated fat intake and the high intake of processed foods, then you have a really high risk of disease. And when you marry together the high intake of vegetation, of these natural plant foods, with a low intake of saturated fat, then you get the most protection. The key is to put all the pieces of the pie together. So here's an important study coming from the Baltimore Study of Aging, where they followed people for many years, and they found that the high fruit and vegetable intake, together with a low saturated fat intake, decreased the risk of overall death rate by 76% to reduction in cardiovascular deaths. Simply spectacular reduction in deaths. And the diet that they were eating wasn't that spectacular. It didn't meet my standards of excellence, but it just had those categories compared to Americans of having more fruits and vegetables and less saturated fat. It wasn't even a super immunity protocol. All right, so we have to remember that we want to move closer to a vegetarian diet, eating natural plant foods, because the pooled studies on that show that as you move closer to either a vegetarian diet, a vegan diet, or a near-vegan diet, you get the lowest rates of heart attacks, and you get the lowest rates of strokes, and you get the lowest rates of the major cancers that afflict America. The major cancers we know are the colorectal cancer, breast cancer, prostate cancer, and pancreatic cancer. Those are the 4 cancers, other than lung cancer, that are killing most people. And we don't have to have them when we eat right. So we want to get close to a diet style that's rich in these anti-cancer foods, but obviously is as close as possible to a vegan diet. Now, a population that follows a near-vegan diet or a vegan diet that's been studied very extensively are the Seventh-day Adventists, especially the group that live in Loma Linda, California. And what they found, they studied these people for years. And here's a 12-year study published in the Archives of Internal Medicine. And they found that the Seventh-day Adventists who usually don't smoke and drink, who are taught to live a healthy lifestyle, the ones that lived the longest were those who ate nuts and seeds on a regular basis. Isn't that fascinating? It wasn't the ones who were the strict vegans, because the ones who ate a little bit of animal products, who ate nuts and seeds, lived longer than the strict vegans who did not eat nuts and seeds. The longest lived people in the study were the vegans who ate nuts and seeds, but the point here is that I'm not recommending a diet that's extremely low in fat. Because some fat, some carbohydrate, and some protein, obviously we need those things, and we don't want to make the diet too low in fat, but like the type of protein and like the type of carbohydrate, it's the type of fat that's important. We don't want to get our fat mostly from animal products. We don't want to get our fat mostly from oils. We want to get our fat from whole foods like nuts and seeds, because they contain the lignans, the sterols, the stanols. They contain the polyphenols. They contain these nutrients that protect ourselves from inflammation, that extend our lifespan, that help absorb the micronutrients into the body for better penetration into our cells. So here again, we want to keep, this supports the fact that we want to eat a diet that's low in animal products and get sufficient nuts and seeds. 1, 2, 3 ounces a day. If you're active and slim, you don't have to restrict nuts. If you're overweight, then stay in that 1 to 2 ounce range. So here's some data from this study. It showed that differences between the vegans or the vegetarians and the non-vegetarians who were eating some animal products was only about 1.5 years difference in lifespan. Not a real tremendous difference in lifespan. But the difference between the ones who ate nuts and didn't eat nuts was almost a 7-year difference in lifespan. That's even more significant, showing you how important it is to eat nuts and seeds, and how Americans basically do not do that and aren't aware of this. So was a completely vegan diet necessary? I guess the answer is I don't know for sure. Nobody does. But we know that it's very important to have a diet that's very low in animal products and very low in processed foods. So here's the point is, if we can design the diet to be healthful and to be powerfully lifespan extending, and you could design that on a vegan diet and make it healthful, and you could design on a diet that has a little bit of animal products, one that you're using as condiments or flavorings. That's up to you. Either way, I want your diet designed for nutritional excellence. Now, once your diet is designed for excellence, then we have to think, well, is there any nutrients I may be missing that's not going to give me that comprehensive micronutrient adequacy that Dr. Fuhrman's looking for? Well, let's think about that for a minute, because yes, there could be some nutrients that are still missing on an optimal diet, and it's your job to make sure that those are optimal. One is vitamin D, because vitamin D is the sunshine vitamin, and a lot of us work indoors. We live in northern climates. We're not outside working in the field in a bathing suit. We're not surfing in Hawaii. We're here in the Northeast, or we're here somewhere, and we're working indoors in air-conditioned buildings, and vitamin D deficiency is epidemic in America, and it can lead to serious illnesses, not just osteoporosis, but also increasing the risk of heart disease and cancer. It's important that, and you know, that sweet spot to have the maximum level of vitamin D in your body means that to maximize your health, you don't want too low a level, and you don't want too high a level either. You want it right in that sweet spot. And that sweet spot for vitamin D on a blood test is likely between 30 and 45. Right around 35 to 40 is that sweet spot. And the best thing to do is to take a vitamin D supplement and then check that with a blood test, the 25-hydroxy blood test, to make sure your level is in that sweet spot. Vitamin B12 is also not in plant foods. You know, if you lived thousands of years ago and you're eating insects and dirt and those bacteria on your food, and you're eating lots of, fermented foods, maybe you get enough B12. But in today's society, our food is triple washed. We're eating very little bacteria and insects and contamination on our food, and we don't get much B12 on our food unless we're eating a lot of animal products. So as you move your diet to the diet style I'm recommending you eat, you have to take a B12 supplement. I'm recommending that strongly to make sure your B12 level is adequate. Zinc is also present in animal products and present in plant foods as well, but there are some nutrients in plant foods that make the zinc not totally absorbable. So we have to be careful to make sure we eat the foods that are high in zinc, of course vegetables and some seeds like pumpkin seeds, but of course taking some zinc as a supplement is a good idea. Iodine is also a micronutrient a person might be low in if they're not using any salt in their food and not eating any seaweed in their food. So you can take a pinch of kelp, take the iodine you need, or you can take a supplement, that has some iodine in it, another nutrient to be aware of. And lastly, what might be low on a nutritarian diet or a diet or flexitarian or near vegan diet would be those long-chain omega-3 fatty acids, EPA and DHA, that are commonly known as fish oil. So a person not eating lots of fish might be low in EPA and DHA, and some individuals may be lower than others because there's a lot of genetic variability here, because some people can convert the short-chain omega-3 into EPA and DHA easier than other people can. And some people's ability to convert those nutrients, to convert those fatty acids into EPA and DHA, go down with aging. So if you want to assure that you have those long-chain omega-3 fatty acid adequacy, then it might be wise to take an EPA and DHA supplement. So keeping in mind we're talking here about supplementation, some supplements can be particularly harmful, and it's most important that you avoid these supplements that could be harmful. And so you have to know which those are. And the most important ones to avoid, of course, are vitamin A and folic acid. I think vitamin A and folic acid are the most potentially cancer-causing supplements that you really have to be careful to read anything you take that doesn't have those in them. So beta-carotene is present in all the natural plant foods you're eating, green vegetables, orange vegetables, red vegetables. Beta-carotene's out there. When you eat a healthy diet, you get plenty of beta-carotene. When you take beta-carotene pills, you may increase the risk of cancer because it may block the absorption of other carotenoids that are in natural foods. You want to get these carotenoids from the food itself, not from the supplements. Vitamin E, 100, 200, 400 IUs a day from supplements has been shown to increase the risk of cancer, not decrease it. You want to get the levels that are in food, and you want to get all the vitamin A fragments that are present in natural food. You don't want to supplement that. You want to get it from a real food. Now, copper, iron, and selenium are also nutrients we need, but the sweet spot is fairly low. When we eat excessive iron, it could be an oxidant that increases the risk of heart disease and cancer. When we eat excessive copper, that could put us at increased risk of cancer. And selenium is something that you might get too much of, and it can have a negative response. Look at this biphasic dose-response curve. It gives you the idea that the sweet spot here for what nutrients that you need can be quite narrow with some nutrients, particularly copper, iron, and selenium, because obviously too little puts you at risk of increased risk of, none obviously puts you at increased risk of death. The optimal level, right in the middle there, but too much increases your risk of, puts of higher risk of disease as well. You want to be right in the center. So I'm suggesting that it may be wise not to supplement with iron, especially for a male. A woman who's bleeding every month, losing iron in her menstrual period, it might be wise for her to take a low dose of iron. But a postmenopausal woman who's not bleeding, or a male, shouldn't be supplementing with iron because the extra iron is not good for them. Likewise, when you eat healthy, you get enough selenium in your diet. You don't want to, even though selenium is helpful as anti-cancer effects, you don't want to be popping selenium because you can get too much. And also, you don't want to get too much copper either. So those are the things you want to be careful about. So to review that here, let me just say that multivitamin use, and there are certain supplements that may be beneficial to take, because in general, multivitamin use is associated with a decreased rate of shortening the telomeres in cells. The telomeres are those strings in the cells that control your genes. And as they shorten, you're aging yourself and you're aging the cell. And so exposure to this huge assortment of micronutrients, achieving micronutrient adequacy, and making sure you have all the micronutrients we're talking about that you need in adequate amounts is going to keep those telomeres long and keep you from aging. So the problem is that most multivitamins contain extra substances like folic acid, like vitamin A, like beta-carotene, like too much vitamin E, these extra substances that can hurt you. The key here is to seek out and find a vitamin that has the good stuff, but not the bad stuff. And I can help you with that, obviously. All right, so to review this, beta-carotene, of course, is associated with lower rates of cancer when you eat them from foods. So beta-carotene, carotene colors carrots, it colors sweet potato, it colors squashes, it makes orange vegetables orange. Lutein makes green vegetables green, that's a carotenoid too. Lycopene makes red things like peppers and tomatoes and watermelons red. And the lutein, lycopene, carotene, cryptoxanthine, all these carotenoids have beneficial anti-cancer effects. That's why we want to eat the full rainbow of foods. And that's the thing, we want to get it from the full rainbow of foods, not from supplements. Because a long time ago, scientists, they measured beta-carotene in a person's bloodstream, and they thought it was doing all the work, and they thought that people would take all these supplements to make them live longer, and they found that it didn't work. It didn't work because, the lutein in the green vegetables in your bloodstream, sure, it's linked to lower rates of heart disease and lower rates of cancer. But it's not just because of the lutein. You can't duplicate that by taking a lutein pill, because the lutein now is a marker for all those other hundreds of nutrients that are present in green vegetables that the lutein was marking in your bloodstream. Do you understanding this now? Why scientists thought that carotene was so protective? Because it was a marker for all the other nutrients that traveled along with the carotene in the food. Because every strawberry has about 700 different nutrients in it. Every green vegetable has 1,000 nutrients in it. So we can't expect to isolate the nutrients and get the same benefits that we would get if we really ate the natural foods. That's what this is all about. This is all about picking those foods that give us the most protection, right? So the Cochrane analysis, it tested vitamin A, beta-carotene, vitamin E, folic acid. And what it found is over the years, surprisingly, just by putting together multiple studies, it found these supplements had significant risks. Also, vitamin A doesn't just increase risk of cancer. Vitamin A supplements increase the risk of hip fracture. It causes calcium loss in the urine. It causes osteoporosis. So it's very important not to take vitamin A, and that's acetyl palmitate and retinol palmitate. Very important not to take that. Now, I want to talk a little bit about folic acid here, because many women know that you take folic acid during pregnancy, and the health authorities are celebrating that their terrific advice they're giving women to take folic acid during pregnancy to prevent birth defects, and the successful outcome that that's had in reducing neural tube defects in children. And I'm saying that's still the wrong way to go. I'm still not agreeing, because food gives us folate, not folic acid. And what they should have been telling women, you need to eat green vegetables and beans and other foods rich in folate to protect your children. Because when you do that, What do you think comes along for the ride? Not just folate, all those other nutrients. Because they found women who eat green vegetables during pregnancy and 2 years prior to conception have children with lower rates of cancer and lower rates of childhood cancer. The number one childhood cancer, the number one cause of death in children, is acute blastocytic leukemia, which is linked to the lack of green vegetables in the diet in the mothers during their pregnancies and prior to conception. Just like medications, the folic acid pills like a permission slip which tells women they don't have to eat right anymore. They just take the folic acid. I'm saying it's not the way we should have gone. If women are so educated to think, no, they should be taking folic acid, why couldn't have they been educated to talk about the benefits of vegetables? So here's the thing. Folic acid during pregnancy has been found that when you follow women 30 years, 40 years later, they've got a significant increased risk of breast cancer in the women who took folic acid during their pregnancy. It didn't have to be. A recent study, a 10-year study of multivitamins with folic acid in women showed breast cancer rates increased somewhere between 20 and 30%. And folic acid is associated with an increased risk of prostate cancer and colorectal cancer as well. In contrast, food-derived folate decreases the risk of cancer and decreases the risk of breast cancer and prostate cancer. That's how you should be getting your folate. The emphasis on folic acid during pregnancy, that's the wrong approach. Because folic acid during pregnancy, now we're finding out, is not even the best thing for the child. Because it increases the risk of the child getting cardiac birth defects and asthma and respiratory infections and ADHD from this combination of taking the folic acid and not eating green vegetables. So if you really want the best for your children, if you want to eat a nutritarian diet, a diet style I'm recommending, get your folate from real food. Then you get all the benefits and none of the potential risks of taking synthetic folic acid. So obviously, poor nutrition during pregnancy and even the consumption of luncheon meats and processed meats during pregnancy and 2 years prior to conception has shown to be a risk factor for the increased risk of danger to your children, such as increased risk of childhood cancer. The diet a mother eats when pregnant is critically important here. And even the diet that she eats before she's pregnant, because the eggs that form the baby are still in the body, living in there before they become fertilized, before they start replicating, they still have the potential to be harmed by a bad diet. All right, copper and iron to review again. Copper and iron are associated with, beneficial immune system effects, but in high amounts, they can have an opposite effect to reduce immune system effects. So we don't want to take too much. We don't have copper and iron because they've been shown to accelerate mental decline like dementia from people taking too many supplements. So iron particularly, I said, should not be supplement unless you're a woman or you're just documented deficiency. Now salt intake. Let's move on to salt. Because you know what? Natural foods, fruits and vegetables, contain sodium naturally in the food. And how long have people, humans, lived on this planet? Like hundreds of thousands of years, right? If we take that hundreds of thousands of years and make it into 100 years, so make the 100 years represent the 100,000 years, then just one day of that period, that's one day of that 100 years, is the amount of time on the planet humans have been using salt in their food. For almost all the time humans spent on the planet, they never ate salt. They never salted their food. They just took in the sodium that was present on natural plants. And you know what? There is sodium there, the right amount we need. But we're taking in excess sodium today. We're taking in 3,000, 4,000. Some countries around the world taking in 6, 7, and 8,000 milligrams of sodium a day. And you know what we see in those countries? 10 times increased risk of stroke compared even to America. Or 10 times increased risk of stomach cancer compared to America because of the link of high salt intake with stroke and cancer, like stomach cancer. Now, the average sodium intake in America is about 3,000 to 4,000 milligrams a day, but that's still way too high and still kills a lot of people. 1,000 milligrams a day would be more reasonable. A healthy diet of natural foods gives us somewhere between 500 to 1,000 milligrams a day. So be careful. Eat natural foods. Try not to salt your foods. If you're using something with sodium in it, only take a couple of hundred extra a day, a little bit of a tomato sauce, or you're taking in some food that was prepared that has some sodium, or a piece of, whole grain bread that has 200 milligrams of sodium. That should be it for the day for you, because your basic food gave you about 500 to 700, and you don't really want to go over that 1,000. So here's the point. The point here is that salt elevates blood pressure, but it doesn't just elevate the blood pressure. Salt stiffens your blood vessels. It causes inflammation in the blood vessels. It's linked to cancers like stomach cancer. It's linked to developing H. pylori or gastritis in your digestive tract. It's a risk factor for kidney disease. And you know what? It's not just some Americans that develop high blood pressure. Everybody in America is on a high salt diet, and by the age of 65, they're almost all taking medications. They almost all develop high blood pressure. You're not going to be the lucky 1 out of 100 or 1 out of 1 out of 20 that doesn't develop high blood pressure from a high salt diet. You think it's not affecting you now, but keep eating the salt, and you know what's going to happen? Eventually, it's going to take its toll. Your sympathetic tone in the brain is going to flip, and you're going to develop high blood pressure. So it's important to avoid salt. And the other harmful effects of salt, it's not just raising your blood pressure. It thickens the lining of your blood vessels, irrespective of its effect on blood pressure. It also has the effect to cause calcium loss in the urine, increasing your risk of osteoporosis. So it's one of the strongest factors associated with stomach cancer. And of course, high sodium intake is associated with death from all causes. So the guidelines for sodium intake, the upper limit, 1,000 a day, only about 200 to 300 of added sodium a day. And keep in mind that salt deadens your taste buds. When you avoid it, your taste buds get stronger, and you can enjoy the subtle saltiness of fruits and vegetables. And you know what? Your taste gets stronger from salt avoidance, and you enjoy other subtle flavors on the tongue, and you enjoy your diet more, not less. Moving on to omega-3 fatty acids. Omega-3 fatty acids are an essential fat because the body can't make them. The short-chain omega-3 fats, alpha-linolenic acid, is found in foods like flax seeds, chia seeds, hemp seeds, soybeans, tempeh, edamame, walnuts, right? It's in the diet. We can eat sufficient omega-3 fats from natural plant foods, and we should. We want to consume some of those short-chain omega-3 fats every day. It's important to do so. Let me repeat that again. Those foods that have omega-3 fats, walnuts, flax seeds, chia seeds, hemp seeds, leafy green vegetables, and of course soybeans have them, like you can eat them in the form of edamame or tempeh. Those foods have omega-3 fatty acids. And then the body takes those short-chain omega-3 fatty acid, the fatty acid is called ALA, alpha-linolenic acid, ALA, and it converts it into EPA and DHA, commonly called fish oil. But you see, just like the fish can make it from vegetables and algae, we can make it as well. But some of us don't make it as well as others. And when you're on a diet that's now you're not eating much fish, you want to make sure you get enough. So we want to make sure we get enough ALA and DHA. So it might be something that we would choose to supplement, because low levels of EPA and DHA are going to be associated with risks, certain risks of heart disease, of depression, of even cancer, of attention disorder, of autoimmune disease, of skin disease, of inflammatory disease. So in other words, just like other important nutrients, we want to make sure we have an adequate intake. The problem is that fish is very high in protein, lifts IGF-1, we don't want to eat much of that, and most of the fish we're getting in America today is made in fish farms. And in the fish farms, they put algicides and antibiotics in the water because the fish are so close together. And we're finding out now in recent studies that fish is some of the most polluted food and the most heavily food with the most concentration of antibiotics we can take in. It's important because some of the antibiotics they use in the fish farm, like nitrofurantoin, one of those antibiotics found in fish, is a cancer-causing antibiotic that really should be avoided. So we're not eating much fish anymore. But we're using it, we're using fish sparingly. And that's what we want to think about, possibly supplementing with a good quality EPA DHA supplement. And by good quality, I mean one that doesn't have contaminants in it, doesn't have mercury and pollutants in it, that's clean. And now they have available today EPA and DHA supplements that are made from algae that is purified and grown in the lab that's very clean. And of course, you don't need much of it, because again, that sweet spot. Too much fish oil. Some people are taking 3 and 4 capsules of fish oil a day, and you know what? That may have negative effects on their health. You just want to supplement with a little, maybe 100 to 200 a day, a small amount of those beneficial fatty acids, because it's marginal. You only need a little bit extra. Some people may not need any extra. But so it's better to take a little, not to take a huge amount. So remember, too much fish, because we think of the pollution, is associated with modest increase in disease, even prostate and breast cancer. And also we know some of the mechanisms, the combination of pollution and the concentration of protein. So you want to eat your animal products in small amounts. And of course, look for cleaner sources. Now, remember, more of these supplements are not better, so take the right amount. Don't overtake the supplements. With any supplement, keep in mind, too much is not necessarily better. Don't go for these high-dose supplements that people think, huge dose of supplements. Don't go for the advertising ploy. We want to go for that adequate level that gives you the adequacy, not excessive amounts. Let's move on now to pesticides. Because sure, I want people to eat foods that are mostly organic, foods that don't have pesticide exposure. Now, the foods that have the most pesticide exposure are things like berries and leafy green vegetables, things that you should look to eat organic when possible. Now, if you can't get berries organic, and they're expensive organic, then get them frozen, because the major pesticide or fungicide on berries are in the fresh berries because they want them not to get fungus on them in the stores. So they don't put the fungicides on the frozen berries because freezing them prevents them from going bad. So frozen food is good, actually. Frozen fruit is picked and frozen the same day it's picked. The freezing locks in the nutrients. Canned isn't good because it sits there in water and it dilutes out some of the nutrients. And the lining of the cans isn't good. But the frozen food's good to eat. And I love frozen berries on my oatmeal in the morning or eat in my salad and things. So here's the thing to keep in mind about pesticides, is that the studies that are people who are exposed to pesticides a lot, like farm workers, and they're the really ones at most danger because they're working with pesticides. They have a higher risk of Parkinson's disease, of multiple myeloma, of leukemia, lymphoma, stomach cancer, prostate cancer. It shows us that pesticides are dangerous. The question is that the remaining amount of pesticides on food, if we're not working with the pesticides on a farm, if we get a little bit extra on the food, is that dangerous? And probably it's not a major cause of heart attack and cancer. Probably it's not one of the major risk factors. The major risk factor is eating the American diet style, which is so high in processed foods. And fast food and junk food, and that's the major risk factor. When people make that change, that's going to save tons, millions of lives in America. But pesticides do increase the risk of some unusual diseases, and they do increase the risk of Parkinson's disease, for example. So it may be wise to try to avoid these when we can. So the most important foods to eat organic, because those are the foods that have more residui, are what I mentioned earlier, strawberries and other berries, like strawberries and blueberries, but also because the green vegetables, the green leafy vegetables, have lots of surface area. The potential for exposure is greater. So I'm suggesting things like spinach and kale, lettuce and collards, those superfoods, those super nutrient foods I want you to eat on a regular basis. Try to get them organic when you can. And of course, celery also is usually treated heavily, and the pesticide goes right inside, hard to wash it off. So those are foods that are important, if you can, to eat organically. All right, before we leave this segment, I want to make sure we talk a little bit about exercise, because exercise is critical. And here's what we've learned, is that exercise significantly extends your lifespan, and it protects you against respiratory infections like colds and flus. Exercise, compared to sedentary individuals, people who exercise regularly have a 46% fewer respiratory infections like colds and flus. Fascinating, isn't it? Just exercise keeps those colds and flus away. And the severity and the duration, how long you're sick, whether you get a mild illness or you're severely, that's affected by whether you exercise or not. So this is very important. And you know that vigorous exercise is important too. These studies show that people who exercise vigorously, and that means that walking is not enough. You just can't walk and expect to dramatically extend your lifespan. You have to do something vigorous. You have to hop, you have to jump, you have to jog, you have to bounce in place, you have to jump rope, do jumping jacks, Exercise vigorously at least 3 days a week. Lift the heart rate up, move up and down. This has a powerful lifespan enhancing effect. So, look, here's the point. Lots of information you need to protect your life, to be happier, to have pleasure in life, to enjoy eating food, to protect yourself against disease. Because you know what? No matter where your health is today, you can improve it. Don't be complacent with taking medications the rest of your life. Don't expect your doctors to give you good health. You can't buy it. You have to earn it. It doesn't come in a bottle. You have to work for it. But you know what? In the process of striving for better health, you'll look better, you'll feel better, you'll have a happier and better quality of life and a longer life. And of course, that's what I'm wishing for you. So put this information into your life, have fun with it, and here's to your good health. Thank you. Here with me today, the presentation is The Failure of Modern Medicine. And this is important. It's important to learn because most Americans have an exaggerated viewpoint of medical care, thinking medical care has added many beneficial years to our life, and they don't have an accurate indication of how potentially dangerous drugs are and medical interventions, and they relatively have a lower expectation of what these things can do for us. If they really knew how the potential risks of medications and the medical interventions that they're risky and do very little to extend human lifespan, I think people would take more charge of their health destiny. They'd eat better, they'd exercise, they realize that they have to be in control of their health, and they can't rely on doctors to do it for them. All right, so first of all, more medical care doesn't mean better health. As a matter of fact, the United States, has the most medical care of any country. We spend more than 4 times as much as anybody else does on medical care, and we have the worst healthy life expectancy to show for it. Worse healthy life expectancy than all other 27 modern industrialized countries. So it's healthy living, not medical care, that brings good health. Healthcare costs in America actually increased 57%, can you believe that? Between the year 2002 and 2006. And 1/3 of medical spending is devoted to services that don't improve people's health, and it may even make things worse. And that was the conclusion of the Kaiser Family Foundation when they studied this in depth. They found that actually most of it's protecting the medical care system, but it actually hurts the patient. So has modern medicine enabled us to live longer? It's hard to know. Because you know what? We did have a shorter lifespan years ago, but that was predominantly due to increased risk of childhood infection and increased risk of children dying during childbirth and increased occurrence of women dying during childbirth. So the question is, are like adult males living longer than ever before? And that's been well studied. And there's even recent studies that track people who lived, adult males who lived 150, 200 years ago, and they found their lifespan was the same as they are today. But we've had tremendous change in sanitation with running water and flushing toilets and hand washing and modern plumbing, and infectious disease plummeted, the past 50 to 150 years in human history. And of course, we are living longer, and medical care is valuable for emergencies and accidents. But the point is, adult lifespan has not increased significantly because of medical care. It's actually increased in spite of it. And we have the plumbers, the engineers, to thank for it, right? Not the doctors. It didn't happen both because of medicines. In any case, the point is that 100 years ago, people didn't live much shorter. They lived about the same once they were, had survived into adulthood. But they only suffered with medical problems the last few months of their lives. Maybe the last 3 to 6 months, they had a little bit of problems that developed. Today, people are sick the last 10 years of their life. So we're not living, so keep in mind that it's somewhat of a myth to think that we have such better health today. We don't. Most of us are worse off. We're worse off because we don't live a healthy life. The only way we can achieve excellent health is if we live a healthy life. Going to doctors for every sniffle and cold and getting antibiotics for viral infections is not lifespan favorable either. We know that antibiotics have potentially adverse effects. There are more than 140,000 emergency room visits because of adverse effects from antibiotics each year. And some of these adverse effects result in people being hospitalized. They're serious. But antibiotics kill the good bacteria. And those good bacteria are needed to absorb nutrients into our body and produce nutrients that are important for us. They're important for our digestion. We actually have more bacteria that live in us and have immune protective powers than we have cells in the human body. The bacteria that live within us are an important part of our immune system. And we kill them with antibiotics. We kill an important function of our immune system to protect ourselves with. And that's one of the reasons why antibiotics are associated with increased risk of cancer. Antibiotics are associated with increased risk of non-Hodgkin's lymphoma, with breast cancer, with birth defects. They're not harmless drugs. They're only appropriate for severe, potentially life-threatening bacterial infections because they're used inappropriately. You go to a doctor and he gives them out with any kind of anything that's wrong with people. There has to be a clear reason why they're being used, and we have to keep in mind when you use that, that there's a significant risk associated with that. 90% of antibiotics are being prescribed for viral illnesses in which they're completely ineffective. More medical care in general means more medical risks. So antibiotics, 25 antibiotics prescriptions over a 17-year period, been shown to double the risk of breast cancer. Radiation exposure, medical testing, increases risk of cancer. Drugs for autoimmune disease increase risk of cancer. I mean, clearly, if there's no other choice, you may have to do some of these things, but there is another choice. The other choice is superior nutrition. Superior nutrition that prevents you from autoimmune diseases, and in most cases, makes you get better so you don't need medications for them. In today's society, prescription drugs have become the first line of defense. Doctors don't try nutrition and good health habits first. They give you drugs first. Healthy habits and prevention, real prevention, is ignored. Now, there's a publication bias in all medical journals because right now, the drug companies pay for and do the studies on their own drugs that they're going to promote. So the studies that don't come out favorable to their drugs, they're not going to even have published. That's called publication bias. They're just going to publish those studies that look favorable to the drugs they're producing. See, years ago, independent universities, medical universities, used to do the studies. Now they can't afford to do that anymore. So the studies are done by the drug companies themselves, pay for them. It's been shown that most drug prescriptions encourage the continuation of unhealthy habits. It gives people that permission slip. Don't ever forget, and I learned this the first week I was in medical school, where the pharmacology professor taught us that never to forget all drugs are toxic. They work because they're poisons that interfere or block some natural body action. So you always have to weigh the risk of a drug and really understand that there was no other option to get well without taking that medication. Let's look at diabetes, for example. Diabetes is the 4th leading cause of death in developed countries. It's a leading cause of adult blindness. It's a leading cause of limb amputation. It's a leading cause of end-stage renal failure. It's serious. And the studies show that, we want people to get rid of their diabetes, right? We want them to lose the weight because diabetes is mostly caused by excessive fat on the body that blocks the uptake of insulin. But instead of having people to lose weight, we give them more drugs to control their glucose level. We give them more insulin. Remember I told you that insulin is a cancer-promoting hormone? It promotes the storage of fat on the body. It makes you gain more weight. It makes you become more diabetic. Or they give you drugs that push the pancreas to work harder to produce more insulin so you can accommodate a high glycemic unhealthy diet. They give you drugs so you can get away with eating an unhealthy diet. If we never had these medications, people would be forced to exercise, to eat better, to get rid of their diabetes, like they did 50 or 75 years ago. But now we take a pill. And you know what the studies show? The more doctor visits you have, the more medical attention, the more drugs you take, the better your glucose is controlled with better medication and more medication, the more your diabetes advances faster and the higher risk of death that you have. The results of the ACCORD study showed that intensive treatment of diabetics with medication to lower their glucose increased the risk of dying compared to the patients treated less aggressively. And you know what? The National Heart and Lung Institute had to stop the ACCORD study because so many more people were dying who were treated with more medications. So diabetic drugs have risks. They cause you to gain weight. They can cause increased risk of cancer. They can make you become more diabetic. The dependency on drugs is not the answer for diabetes. Diabetes disease is a nutritional related problem and should be treated nutritionally. Similar with high blood pressure medications. I'm sure you know almost everybody in this country is taking medications for high blood pressure, right? They're all taking medications. Once you're over the age of 60, more than 90% of people are popping pills. And half of our population below the age of 60 is taking medication too. We're an overly medicated society. And you think, well, just take blood pressure medications, that's it. Not about cutting salt out, exercising, and eating right anymore. It's about taking pills. Sometimes people are taking 3 and 4 medications and the blood pressure still doesn't come down. But you know what? These pills are not without risk either. As you take the pill to lower your systolic blood pressure and your diastolic blood pressure, the diastolic might get too low to bring the systolic down to a safe range. Let me say that one more time. Because systolic is the first number, and diastolic is the second or lower number. And the difference between the two numbers is called your pulse pressure. So if your bottom number is 50 and your top number is 100, the pulse pressure is 50. If your top number is 120 and your bottom number is 100, that's a pulse pressure of 20. The difference between the two numbers, right? Now what blood pressure medications do is in order to get the top number down into a favorable range, they do so by pushing the bottom number too low. And when the pulse pressure widens, and as the bottom number gets too low, it's hard for the blood to flow back to the heart during diastole when the heart relaxes and the blood vessels relax. Let me explain this a little further here. It's that your heart pumps, and the blood shoots out of the heart, and the blood vessels then relax. They widen to accept the flow of blood, and that's the first number. As the heart relaxes now and refills, and the blood is not coming out of the heart, the vessels contract. They push in, and that's the second number. When the second number gets too low, there's not enough pressure on the blood returning to the heart during the refilling phase, the heart doesn't get enough oxygen, and it increases the risk of irregular heartbeat, sudden cardiac death, heart attacks. What I'm saying here is that from the use of medications, when the diastolic blood pressure is pushed below 60, these individuals have 3 times the risk of heart attack rate and dramatically increased of irregular heartbeat, like developing atrial fibrillation. Drugs like beta blockers have been shown to actually increase stroke risk. A lot of times they lower peripheral blood pressure in the arms, but they don't lower blood pressure in your brain, giving you a false sense of security. When you eat right and cut out the salt, it lowers blood pressure everywhere. It reduces inflammation in the blood vessels. And it doesn't just reduce your blood pressure. It improves your cardiac function. It reduces inflammation. It lowers your cholesterol. It reduces the ability of the blood to clot. See, eating right does much more than a medication can do. The over-reliance on medication is increasing our mortality in America because we're expecting medications to do things for us, and the medications don't do so much for us, and they have risks. Like the beta blockers increase glucose levels, increasing risk of diabetes. Yet these drugs are the 4th most commonly prescribed drugs in America, without mortality benefits. We have to use less medications, not more medications. Look at what happened 100 years ago. 100 years ago in America, we had only 3% of Americans dying of heart disease. 3%. Now it's up to 40%. Why do you think we see this tremendous increase? The drugs aren't protecting ourselves. It's the worsening of the diet that caused the problems. We got to get back to a healthier diet. That's the answer for Americans. It's the answer for you. Nobody has to die of a heart attack. You don't want to die needlessly of a heart attack. A guy 3 houses down from where I live dropped dead of a heart attack. Didn't have to be. Do you know that about half of all heart attacks, people don't even get to the hospital? They die before they get there. And about 40% of heart attack deaths, the people had no signs or symptoms that warned them they had heart disease, and that their heart attack that in half the cases killed them was their first sign of heart disease. When's the time for you to make this change to a healthy diet? Till your doctor checks you have high blood pressure? Till he finds your cholesterol is high? No, the time is now. The time is before you have anything found wrong with you, because you still could have a heart attack from eating the American diet, because the American diet style is heart attack causing. But you don't have to have a heart attack. Countries around the world that eat predominantly natural foods don't have heart attacks. Studies with people with advanced heart disease show that it can be melted away with excellent nutrition. And my experience over the last 20 years with patients with severe heart disease, told they need angioplasty or bypass surgery, shows even in those cases, their heart disease melts away and they can get totally well and not have a heart attack in their future. You know why? Because when you look at the studies on people going through angioplasty or bypass surgery, it doesn't reduce the risk of heart attack in their future. It just temporarily relieves chest pains, and they still have the same risk of having a heart attack or dying from heart disease after the procedure is done. Look at this slide, which demonstrates a study done, published in the medical journal Metabolism, on my nutritarian diet style. And what did it show? In this well-done study, it showed that people decreased their LDL cholesterol 33% in just 6 weeks' time. That's more powerful effects than cholesterol-lowering drugs. But when they lowered it with good nutrition, it's much more positive effects on the body. You lose weight, you get better exercise tolerance, you protect yourself against cancer, you reduce inflammation. You don't just lower the cholesterol. All the inflammatory markers like CRP comes down too. In other words, you get a host of benefits that exceeds the benefit from just cholesterol lowering alone. So cholesterol lowering drugs can't do that, and they raise your glucose levels. A low-fat vegetarian diet is not as effective as a nutritarian diet that's better designed with the portfolio of beneficial foods to protect your heart and accordingly lower your blood pressure. A high-protein diet, the American Heart Association diets, the Mediterranean diet, they don't have these beneficial effects as a diet specifically designed for longevity and disease reversal that I've named the nutritarian diet. Now, keep in mind that heart attacks are caused not by the obstruction in the blood vessel, but by a clot. And you know what? The place in the heart where those clots occur are not the place that are most obstructed. So when you go to a doctor with chest pains, or when he gives you, a cardiologist gives you a stress test, or even a cardiac catheterization or angiogram, and they say, you've got this major blockage in your heart, and we're going to fix your heart by blasting that blockage open, he's not helping you. He's not reducing your risk of having a heart attack, because more than 75% of heart attacks don't occur in those spots in the heart that are blocked. Matter of fact, those spots in the heart with the biggest obstructions have a heavy calcified plaque covering the obstructions. They're thickly calcified walls that are less likely to crack, fissure, or break because the plaque is older. It's the newly laid down plaque, called the juvenile plaque, that has a smaller, a softer, thinner cap that is more mobile and can rupture a crack. That's where the spot in the heart is where you're at high risk of having a heart attack and a clot being formed. So when a doctor takes you in and evaluates you and gives you a stress test, the stress test is only going to be positive if you have more than a 75% obstruction. But if you don't have a 75% obstruction, you're not free of risk. You have the same risk. The stress test never just can't tell you if you're at risk or not, because what I'm telling you now is even the ones that are invisible to cardiac testing, even the 30% obstructions, even the 20% obstructions, even those that are invisible to cardiac catheterization and angiogram still could be placing you at risk. Those tests don't tell you if you're at risk or not. The things that tell you you're at risk is a tape measure around your waist, where your blood pressure is running, the type of diet you're eating, how much exercise you can comfortably do. Those are the things that determine your risk, not these invasive medical procedures. So the doctor, the cardiologist, puts you through this stress test, determines you have a blockage, gives you a cardiac catheterization, treats you with an angioplasty or bypass surgery. Did that make you live longer? No, it didn't. The studies on this show that you don't decrease the risk of future heart attack because he never addressed the problem. The problem is diffuse atherosclerosis and vulnerable plaque all over the coronary tree. Him addressing that one area and putting a stent in actually creates more inflammation in the heart now, because where the stent ends, it irritates the blood vessel lining, and clots could form even more there. So now you have to be put on medications the rest of your life. Medications that can cause a hemorrhage in your brain or a gastrointestinal bleed. Medications that you have to take the rest of your life that are risky. And now we cause scarring in the heart from stretching it out, which now restenosis could occur. And restenosis has scar tissue mixed in with it. And restenosis is an iatrogenic disease. Iatrogenic means doctor-caused. It inhibits the ability of the native atherosclerosis to be reversed by nutritional methods and exercise. You'd be better off if you never went to the doctor. You'd be better off if you went immediately and changed your diet, dropped the 30 pounds you need to lose, go for the long walks, eat right? And then if he gives you the test and the test comes out normal and the stress test is negative, he reassures you that nothing's wrong and that reassurance wasn't justified. The point is here is that the basis of cardiology is these outmoded and disproven ways of practicing. It's an outmoded procedure. So the point here is invasive cardiology procedures are not effective. They don't make you live longer. Patients undergoing these procedures have more problems in their futures, not less. Infection, bypass surgery can cause dementia to happen. You don't get blood flow to the brain. These things have significant risks. The goal is to cure your heart disease and cure your diabetes, not control it with drugs so you can eat unhealthy, not do procedures on you so you have stents all over your body. If you have a problem, get rid of it. Reverse it. It's reversible. Remember here, I can't repeat it enough, it's not the fat you have to take out of your diet, it's the fat you have to take off your body. To want to get well, you have to have your body fat go down. That means you have to eat right and you have to know the foods that help fat melt away from your body. If you're a woman, you have to drop your body fat below 27%. If you're a male, you have to drop your body fat below 17%, because it's the only way you're going to significantly reduce the plaque from inside the blood vessels. It's necessary. Here's an example, John Pelikowski. Now, John came to me back in 1994 when he was 72 years old with triple vessel disease in his heart. His cardiologist told him he needed urgent angioplasty. He needed urgent triple angioplasty. Did he have the angioplasty? Nope. Because I told him, you know, John, by the time you go through those procedures, I could have your chest pains going away in the next couple of months. You follow my program, you lose weight, your heart disease can melt away, and you don't have the risks of having those stents put in and having the restenosis occur. So he did it. He dropped 60 pounds that year. I think he went from 220 to 220 pounds down to 160 pounds. John's chest pain went away in a few months. He never needed medication again. But you know what? Here's the thing to remember with John. Because John's been my patient now, up till now. Now he's in his 90s and he's in great health. He just climbed up on his roof and repaired his roof. He chops wood. He lives his life. He does things now in his 90s he couldn't do back in his 70s. And I'm seeing these patients like John that came to me when they were sick years ago that are now older. I know they're going to live a long time. I know the potential to live a long time that nutritional excellence grants you is utterly amazing, because I see it every day with these patients in my practice. And you know what I've seen with John? I've seen that as he got older, he got healthier because he followed the diet longer. Whereas first year on the program, where he came off the medications for his blood pressure was a little bit borderline high on no medication. But as the second year went by and the third year went by, his blood pressure went lower and lower. He got healthier and healthier the longer he was on the program. You know, it's like water runs off a waterfall and hits a rock. And after 30,000 years, the rock splits in two. But the rock didn't age, the water hit it day after day. If you hit yourself day after day with the wrong foods, you're aging yourself. You're causing damage. Damage is cumulative, little by little, like the water hitting the rock. And just like that, you can reverse the disease little by little. And disease reverses relatively rapidly, because these people with chest pains, with blockages and obstructions in their heart, they don't have to get the whole blockage cleaned out to have the chest pains go away. They just got to reverse it maybe 10% and the chest pains go away. And then it can slowly reverse, through the year that follows. And they're safer automatically, safer than they ever will be with medical procedures. Look at Julia. Julia, incredibly, had 3 heart attacks in just a few-month period, actually. She was sent home to die. They couldn't help her anymore. Nothing more they could do for her. She couldn't even walk a block. She had multiple angioplasties. She weighed 225 pounds. She was on 10 medications. She said she never liked vegetables. She came to me as a patient. She got totally well. She dropped 120 pounds. She weighs half of what she used to weigh. You know what? Her chest pains are gone. Her heart problems are gone. She goes to exercise class. She couldn't walk out of her house before. Now she attends, like Zumba. Now she goes shopping. I actually was at her son's wedding, and I was dancing with Julia at her son's wedding. She was bed confined years ago. She's off medications. She doesn't have heart disease anymore. These are examples of people that have taken charge of the health destiny. And Julia says that now she enjoys every day of her life. And she feels bad that she couldn't have learned about this years ago before she had to get so sick and suffer so much. Nobody told her. Her doctors didn't tell her. They just gave her medications and more procedures. So, you know, this is important information. This is important information that every American needs to know, because the medical profession is driving us often in the wrong direction. We're getting the wrong message. So look at Julia here, where she said she went from a cardiac cripple to a healthy, happy human being. Isn't that just thrilling? Can you imagine me seeing all these hundreds of people doing this and getting these hundreds of letters of people who have this happen? And it really makes this exciting. And it's exciting for you, because when you take care of your own health, you become a role model for other people, and you affect them positively as well. And it's such a great feeling to take care of your own health and be a positive role model for others. Here's a patient of mine, James Kenny, weighed over 250 pounds, 2 heart attacks, advanced diabetes. I remember his glucose readings he was taking hundreds of units of insulin with oral diabetic medications simultaneously, and his sugar couldn't come down. He was treated with medicines, and there was more medications and more medications and more medications, and they couldn't bring his sugars down, still above 350 at glucose level. It wasn't until I taught him how to eat. And did I make him eat thimble-sized portions of food? No, he eat big portions of healthy food. But of course, they were the right foods. And within that first month, I was decreasing his medication. His glucose was better controlled after the first week than it was for years. 5 months later, he was on no medication, just glucophage, just one medication. He was 70 pounds lighter. His kidney function normalized. You know what's funny with Jim? Is that these doctors have diabetic specialists caring for them, but he wasn't referred to me by his diabetic specialist. He was referred to a kidney doctor with a nephrologist, and the nephrologist recommended he come to me, and that's when he finally got well. I think doctors may be a little nervous. They're going to lose their patients. But the point is that the doctor, and your doctor, when he finds out about the positive effect and sees you losing weight and getting a better health, he's going to be jumping up and down with you. He's going to start to get reward from his practice. He's going to feel better about watching his patients get well, and he's going to like his job more. So I think a lot of doctors are thrilled by this information. They're using it in their practice too. So I give the impression sometimes that, that years ago, doctors aren't telling people this, but it's happening. Doctors too are changing. Just like the American public is changing, and you're changing and learning this information, they're learning this too, and many of them are applying this today. So the guidelines for reversing heart disease and lowering your cholesterol is eat a vegetable-based diet. Eat as many raw vegetables as you can. Eat berries, eat kiwis, eat pomegranates, eat apples. They have all types of micronutrients, polyphenols and anthocyanins and pectins and all types of nutrients in those fruits that lower cholesterol and reverse heart disease. Eat a large portion of steamed green vegetables every day, like broccoli or asparagus or Brussels sprouts or string beans. Eat some beans every day in a soup or on a salad or in a bean burger. Eat some nuts and seeds every day in a salad dressing, in a dessert, on your cereal, on your oatmeal or something. Reduce or eliminate animal products to just 2 small servings a week. So do the right thing, and one of those servings should probably be fish. In other words, do the right thing, because you're not going to get help. You're not going to most likely get help from your local doctors. The American Diabetic Association says there's no cure for diabetes. I say, don't treat your diabetes, don't control it, get rid of it. Just get rid of it. Do what it takes. Do whatever it takes to get well. Bottom line here is that the American Heart Association's diet that they recommend is not good enough. The diet that your doctors and dietitians recommend is not good enough. It's not good enough if you're still diabetic. It's not good enough if you're still overweight. It's not good enough if you still have heart disease or high cholesterol. You have to do what works. Moderation kills because the disease is allowed to advance. We have to do what works. Now, sometimes medications work, and sometimes they don't. But flu vaccines, the benefits from flu vaccines, have been hyped up. They don't work very well. So flu is a significant illness. There's about 100,000 people hospitalized each year from flu. There's some people that die each year from the flu, mostly people that are immunosuppressed from poor nutrition, because when you're immunosuppressed from poor nutrition, you are more vulnerable to viruses hurting you. And a major complication of death is bacterial pneumonia. But the vaccine, the flu vaccines, isn't going to change that. And it doesn't change that because there's more than 200 different viruses that cause flu syndrome. And the vaccine only is focused on 2 or 3 of those viruses expected to be most common in the next year's infection that comes around next winter. The flu vaccine can only be partially effective, yet the CDC recommends everybody 6 months in age and older gets a vaccine every single year. I mean, every year a vaccine, that's going to expose a lot of us to formaldehydes and mercury each year. For this to do that, we got to make sure it really is very effective in reducing the risk of death and reducing the risk of hospitalization, reducing these complications. But should we vaccinate everybody? Does it reduce these complications? Is the flu dangerous to healthy people? Well, the Cochrane people in Europe, they were not biased. They independently analyzed all the analyses. They looked at every study done by the drug manufacturers. And what they decided was most of these studies were biased because they only studied the best case scenario when the strains matched the vaccines. And what they found in the real world was the vaccinations did not affect the number of people hospitalized, and they did not affect the days lost from work, and they did not reduce the complications or deaths. And the safety data on children under the age of 2 was not done, and the benefits were similar to placebo. You know, there are some reduced symptoms and benefits in elderly populations at high risk, but the trials were funded by the vaccine manufacturers, and only a limited number of them showed benefit. The conclusion here, their conclusion, was the vaccine only has a very narrow margin of benefit. And we think that and for most age groups, it's of no benefit. So should we follow the CDC's recommendations? Because much of what they do is affected by political and economic concerns to the drug manufacturers. According to the Cochrane researchers, the best scientists in the world studying this, not my opinion, this is their opinion, the best scientists in the world studying flu vaccines, they say the CDC authors, the Center for Disease Control in America, do not weigh interpretation by the quality of the evidence, but quote anything that supports their theory. In other words, they are the preconceived theory they're trying to support. And almost all the 15 members of the CDC's Advisory Committee on Immunization Practices have financial ties to the vaccine industry. So we're not getting straight information in America. The flu vaccines have some risks associated with them. We don't study the long-term risks that affect. We're not looking at that. There's adverse effects that are possible. So I'm suggesting here that unless you are in a nursing home over the age of 75 with some serious medical condition that could potentially put you at risk of death if you get an infection like a flu, then probably you shouldn't be taking the flu vaccine. So weigh the benefits and risks of any medical intervention. Decide for yourself. The complications and risk of death are serious from anything, from even a simple viral illness is possible, even though it's relatively rare. But there's nothing that gives you a complete free ride in life. And all medical interventions have some risk. What I'm suggesting here is that reducing your risk in life means we have to try to avoid medical care as much as possible by placing ourselves in superior health. That's how we really reduce our risk the most. Consider the bisphosphonates, medications used for osteoporosis. They have significant risk too. They increase the risk of irregular heartbeat by 50%. They cause atrial fibrillation after long-term use. They increase the risk of reflux esophagitis, and then you're giving a drug for the reflux esophagitis, for the heartburn, like these proton pump inhibitors. And those drugs also increase the risk of osteoporosis. And those drugs increase the risk of pneumonia. They give you one drug to counter the effects of the other drug, and then you'll give you another drug, like Coumadin, because you'll develop atrial fibrillation from the bisphosphonate. The one medication, you'll be taking one medication to counter the side effects from the other medication, and a third medication to counter the side effects of the second medication, and another medication to counter the effects of the mixture of the first medication and the third medication together, because it's not real well studied, because the scientists don't study the mixture of 4 medications together and what could happen. And what they're giving women to prevent osteoporosis could cause muscle cramping, bone pain, and after years of use, it can make it more likely for their femur to fracture. So these are not without risks. Yet women who engage in regular exercise, regular vigorous exercise, have twice the reduction in hip fracture rate compared to drugs like the bisphosphonate drugs like Fosamax. Jumping and bumping from side to side, bouncing from side to side, jumping rope, hopping, skipping, doing all types of exercises, stepping up and down on a step, getting up and down from a chair, going for walks, jogging in place. There's so much things you can do and to decrease the risk of hip fracture, and making sure you have vitamin D adequacy. Keep in mind here that exercise doesn't just increase bone density, it increases muscle strength and improves balance. And the fall isn't caused by a weak bone. The fall leading to a hip fracture is caused by weak muscles. And as you strengthen the muscle, it thickens the bone simultaneously. So, of course, the primary cause of hip fracture in the elderly is weak muscles, not weak bones. So the nutritional causes of bone loss, to review, the nutritional causes of bone loss are too much animal protein, which acidifies the body, and the acids have to be balanced, leaching more calcium from the bone. Too much salt, which causes us to lose calcium in the urine. Too much caffeine, which can cause us to lose calcium. Vitamin A supplements, tremendously powerful, making us lose calcium. Insufficient vitamin D, that's the main thing. More important than taking calcium is vitamin D. Plenty of calcium in natural plant foods. Green vegetables, seeds, beans are all high calcium foods. You don't just get calcium from milk, but the vitamin D we don't get from food. We got to get it from the sun or take a supplement. And a low nutrient diet. Osteoporosis is not based on one nutrient, it's based on the full spectrum, that full symphony of nutrients we need from a big assortment of natural foods. Now let's consider breast cancer screening, mammograms, PSA testing in men, and prostate cancer treatments. First of all, the breast cancer rates have gone up in recent years. Even in the last 20, 30 years, the incidence of breast cancer has gone up a little bit because we're doing more tests and we're diagnosing women with breast cancer. Now, has that made us save a lot of lives from breast cancer? And look, it shows, the data shows, published by the United States authorities that measure the data, the Center for Disease Control, so that breast cancer mortality has gone down a little bit. Just like, same thing with PSA testing and prostate cancer. We're getting an increased incidence. That means we're seeing it go partially because of the increased testing, revealing and diagnosing people with it. And the effect on prostate cancer deaths, people dying from prostate cancer, because it has decreased a little bit. Well, that's the thing. It's just decreased a little bit. It's not wiped it out, just a small decrease. Now, the Nordic Cochrane Center in Denmark is famous for their independent analysis, for their comprehensive, non-biased research. And they're looking at this data, and what they find is that we're not getting the benefits we think we're getting. You know why? Because there's a diagnosis bias. There's a bias because we're diagnosing these people at an earlier age, and they would have known they had cancer. So it looks like they're living longer with cancer because they would have never known they had cancer until 5 years later. So it looks like they're living longer with cancer, and they're just still dying at the same point. And the very few people that are helped, it's only been shown that only 1 in 2,000 women undergoing mammograms actually have their lifespan enhanced from the treatment, whereas 10 in 2,000 are hurt in some way from mammograms and subsequent treatments. And you know what? Many of these women who undergo treatment for breast cancer now die prematurely from heart disease because of the negative effect of chemotherapy on the heart. So here's what the answer. What's happening is that even though we're getting a reduction in breast cancer deaths, and that's been recorded and being advertised, we're getting an increase of leukemia, of cardiac deaths, of fatal lung cancer caused by radiation exposure, and by congestive heart failure caused by chemotherapy. And the people reporting the lower rates of breast cancer deaths on the studies didn't include the increased deaths from these other causes from the treatments. So because they didn't consider these other causes of death, the overall effect on overall mortality in women is almost negligible for medical care. In other words, mammograms have a very, very slight effect on benefiting some women, but most women see no benefit. The vast majority see no benefit. What am I saying here? I'm not telling you whether to have mammograms or not to have them. That's not the point. I'm telling you that you can't expect large benefits from medical interventions. You have to, if you want to see, if we want to win the war on cancer, we can't wear pink ribbons and just run to get tested. What we have to do is take charge of our health destiny by eating a diet that's protective. We have to take charge of our health destiny by getting superior immunity. So remember, most of what physicians do has a very small effect in extending lifespan. And drugs that attempt to reduce the effect of a low-nutrient toxic diet are not very effective at extending your life. And all drugs and all medical intervention and all medical testing has risks, and those risks have to be weighed. So all drugs and medical interventions have risks, and those risks and benefits have to be considered. And the secret to living a long, a pleasurable, and happy life is taking care of your health, and never forget that proper health care is the best self-care. And your best medicine cabinet is in your kitchen. And your best medicines are found in your grocery store and on the farm. So I wish you superior health and a long and pleasurable life. Thank you. Welcome. We're talking now about resolving food addictions to solve America's health care and obesity crisis. This is an important subject because the Americans are totally confused about what to eat. They couldn't eat a worse diet if we designed it to create a cancer and heart attack and obesity epidemic from scratch. Americans are now eating 62% of calories from processed foods. Can you imagine that? How could that have ever occurred in human? Could we have expected that to occur in human history? I remember when I was a child, we were worried about atomic bombs, and here we've bombed ourselves and causing people to die every second. We have the most highest rates of cancer and heart attack in human history, the highest rates of obesity and diabetes in the world of any population that ever lived in the history of the world is in America today. Look at what Americans are eating. 26% of calories from animal products, 62% of calories from processed foods. What I'm saying here is that processed foods like white bread is just like a piece of chicken because neither one contains antioxidants and phytochemicals. They don't contain those micronutrients that we need that are predominantly found in natural plant food. The formula here, my secret formula, which you've maybe heard before, that describes or evaluates and measures how long you're going to live, your healthy life expectancy, the quality of your life in your later years, represented by the H, is that healthy life expectancy can be predicted by the nutrient per calorie density of your diet. And that means to eat a diet high in micronutrients per calorie, you have to know what foods are high in micronutrients per calorie so you can eat more of those foods. And what foods are low in micronutrients per calorie so you can eat less of those foods. So you don't have to ask me, what about this oil or that oil? You should know oil is a food that's concentrated calories without much nutrients in it. It's a food low in micronutrients. So is it a longevity-promoting food? Obviously not. We want to eat the walnut, not the walnut oil, the sesame seed, not the sesame oil. We don't want to extract the nutrients, the fiber, the phenols, all the beneficial anti-cancer, and concentrate the calories, because when we take oil in a concentrated calorie form, the body can't modulate its absorption. When we eat the walnut or the pistachio nut, all the calories aren't biologically available to the body. As a matter of fact, a big portion of those calories are lost to digestion. They're lost and go in the toilet. We take the oil from those foods, 100% of those calories get rapidly absorbed. And because they're so rapidly absorbed, they get stored as fat quickly. And fat on the body is cancer promoting. And fat on the body is heart disease promoting. And fat on the body is dementia promoting in later life. Fat on the body is like a tumor. It shortens your life. When you eat right, you don't get fat on the body. So here's a person, Tom, who's eating 2,000 calories a day, and he's slim. And here's a guy, Bob, who's eating 2,000 calories a day, and he's got 40 pounds of extra fat in his body. They're both eating the same amount of calories. The difference? Tom's eating high nutrient calories, because when you eat those high nutrient foods, it makes it very hard to store fat. When you eat the whole nut or seed, even if it was the same amount of calories, it would make it very hard to store fat because the nut or seed has these sterols or stanols that suck fat out of the body into the stool. So H equals N over C. If you understand this, you'll be able to understand why sweets and white flour and donuts and cookies and candy and pretzels and all these foods, you'll understand better why when you eat foods that don't supply us with nutrients, it builds up free radicals in our tissues. It creates toxic waste products in our tissues. It's not only the waste in the food, it's the waste the foods produce in the body. Now, when you eat greens and beans, when you eat real natural foods, the opposite occurs. Because these foods are rich, of course, greens are very low in calories to begin with. They're almost like taking they're taking like straight nutrients into the body. They're just micronutrients because they're so low in calories. Their green vegetables are less than 100 calories a pound. How many pounds of them can eat? You eat 10 pounds, you still wouldn't even get enough calories in. If you were Tarzan living with the gorillas in the woods, you would eat, you'd be too thin because you'd be eating plenty of protein, plenty of calcium, plenty of nutrients. But because greens are so low in calories, you'd have trouble getting enough calories in. Why am I telling you that? To show you that the more food you eat, the more weight you're going to lose. You're going to slim down. You could even be too thin by eating too much greens if you wanted to. In other words, you don't have to be overweight. You can eat tons of food. You don't have to not be satisfied with eating. You can eat as much as you want, but eat the right foods. And when you eat beans, you lose weight too. You know why? Because beans have resistant starch. They're full of this carbohydrate that doesn't get absorbed. Remember I told you oil got absorbed very rapidly? Well, beans have two types of carbohydrate in them. One is called slowly digestible starch that gets broken down very slowly. When you absorb the calories slowly, the body could modulate the absorption, and it doesn't go to fat storage. It goes to, you could burn them off better. It causes fatty acid oxidation. You burn fat for energy better when the calories are absorbed slowly. And beans have slowly absorbable starch. It's called slowly digestible starch, but it's slowly absorbable. And half the carbohydrate is resistant starch, which means the body can't even break it down into carbohydrate. It goes to the digestive tract, and because we can't enzymatically break it down, it gets broken down by bacteria into a fatty acid called butyrate. Now, the bacteria that break this down do so far down in the digestive tract, towards the end of the small intestines and the early part of the large intestines, that 90% of those calories are lost. Means you don't absorb them at all. That means about half the carbohydrate calories in beans don't even get absorbed. And the 10% of that fat that's absorbed, the carbohydrate gets turned into fat by the bacteria, and the 10% of that fat that does get absorbed, that fat has therapeutic effects to speed up fat loss in the body, to help you burn fat. It oxidizes fat more. It has anti-inflammatory effects against cancer. It helps soften the stool and prevent inflammation in your digestive tract. In other words, the resistant starch in beans is something very favorable, and they're also highest in fiber. So take a look at this slide where I've showed that the higher level of resistant starch and added up the resistant starch and fiber to show how weight loss favorable these carbohydrates are compared to white flour or white potato. So we want to eat less of those foods and more corn, split peas, lentils, beans, soy. As we eat more of these beans, you lose weight without difficulty. Weight loss doesn't have to be from dieting. It's not from dieting at all. It's from eating right. Your weight comes off because you don't have to eat thimble-sized portions of food and go around starving yourself. Eat as much as you want, but you eat delicious-tasting food that heals the body and melts the fat off you. Now, let me review this. The resistant starch in beans promotes the growth of good bacteria in the digestive tract. That means those good bacteria that actually are fueled by eating of beans improve immune function. Those good bacteria produce nutrients, and they help digest the beans too, so you don't produce gas. Beans lower glucose, great for a diabetic. Lower your insulin sensitivity. We want that. That reduces risk of cancer. And plus, remember I told you insulin is a fat storage hormone. It promotes angiogenesis. It promotes blood vessels to grow to sustain fat on your body. Beans, stop that. Mushrooms, stop that. Greens, stop that. Onions, stop that. These proper foods stop the ability of the body to store fat. They soften the stool, they prevent constipation, they reduce fat storage after the meal, they protect against development of cancer. So, beans are one of the superfoods. Beans, the wonderful fruit. You've heard that one. And they have in them inositol pentakis phosphate, IP5, that don't allow tumors to grow. They have an anti-tumor effect. Eating beans regularly dramatically lower your risk of cancer. That's the point. We want to avoid foods with a high glycemic load, foods like white rice, white pasta, white potato, chocolate cake. Those are the foods with high cakes and cookies and candies. Those are the foods with high glycemic effect. Beans give you carbohydrate, have a low glycemic load. Berries, fruits, nuts and seeds, green vegetables, all the things onions, mushrooms, all the things I'm telling you to eat are not only high in nutrients, they are very low glycemic foods. You can still eat all these good carbohydrates. These good carbohydrates are nutrient-rich, relatively low in calories. The carbohydrate they do have doesn't spike an insulin response. They have all the beneficial effects that healthy foods are supposed to have. Just like brings us to nuts and seeds, which people think they're fattening, and they are. But the studies on nuts and seeds show that the people who eat them lose weight. How come? I thought they were fattening. Well, you see, all the fat isn't biologically absorbable like it would be if you took the same calories from oil. And the nuts and seeds have beneficial effects to reduce inflammation, prevent and reverse heart disease, to stabilize the heart from developing arrhythmia, even to stabilize the brain. Studies on nuts and seeds show a dramatic reduction in all-cause mortality. That means all causes of death, and that means both cancer and heart disease and stroke when you eat nuts and seeds on a regular basis. They've been shown to reduce gallstones in people losing weight. People have a lower BMI. They've been shown to lower cholesterol level, lower triglyceride levels. When you substitute an equal amount of carbohydrate from potato or rice for nuts and seeds, it lowers your triglycerides, it lowers your LDL cholesterol, it lowers the insulin level in your bloodstream. All the proper hormones come into balance when our fat in our diet comes from the whole food nuts and seeds. And they contain the lignins that protect against cancer. Now, the secret here to losing weight is not merely eating the right foods, it's also getting rid of your addiction to the wrong foods. But the more you eat the right foods, the more you lose your addiction to the wrong foods. This is also very important to recognize that what most people think is hunger, which they see as shakiness and weakness and fatigue and anxiety and stomach cramping and headache, what they're calling hunger, I'm saying emphatically, is not hunger. Those are withdrawal symptoms from a poor diet. You're eating because you're an addict, not because you're hungry. And the way to get a favorable weight is to get rid of those symptoms of ill feelings by eating right. So hunger's complicated. It's multifactorial. It's affected by the volume of food that you're eating. And I want you to eat a lot of volume of food. I just want it to be the right food. It's affected by the nutrients you consume. It's affected by the calories that you're consuming, and it's affected by these signs of food addiction. So let's talk about this. Number one, let's talk about volume, because I want you to eat the high volume foods. I want you to eat foods like raw vegetables, snow pea pods, tomatoes, beets, cucumbers, carrots, cabbage, raw vegetables high in volumes, softens the stool, protects you against cancer. Chewing them in your mouth forms the beneficial anti-cancer compounds. Raw vegetables chewed by you is an essential part of good nutrition and good health. But it suppresses your appetite. When you eat cooked greens, they're also low in calories. I want you to have a big portion of cooked greens every day. Fresh fruit, melons, grapefruits, berries, kiwis, papaya, all kinds of fresh fruit. It's low glycemic, low in calories, suppresses your appetite, and makes you feel good after you eat a meal of a piece of fruit. It marks the end of eating for the day after you had your nice dinner and then had a piece of fruit afterwards. You clean your teeth, you clean the kitchen, and you don't eat the rest of the night. You don't eat till you're hungry again. And the non-green vegetables, the non-green low-calorie vegetables like mushrooms and onions and eggplant and tomatoes and peppers and cauliflower, all these foods, right, all these low-calorie, high-nutrient foods. Let me review the 4 classes I just said. Raw vegetables, whether they're green or not, even the carrots and beets. If they're raw, don't forget, all the calories aren't absorbable. Let me say that one more time. When you cook the carrot, more of the calories are available. When you make it raw, you lose more of the calories. Raw vegetables, you lose some of the calories. You can't absorb as much calories from it. You eat a lot of raw foods, it helps you lose weight. Raw vegetables, cooked greens, fresh fruits, non-green vegetables. When you eat these foods, when you eat lots of these foods, it occupies a lot of space in the stomach because the stomach can only hold a liter of food. You know? If you lived on some primitive island, or you lived eating natural plant foods on your diet, you couldn't become overweight. It's impossible. It's only with processed foods and oils and salt and cheeses and things we do to make it so calorically concentrated. It's hard to become overweight. You ever watch the show Gilligan's Island? I did when I was a kid all the time. And I finally figured out scientifically with years of study and contemplation that Skipper never really lived on that island. He couldn't have, right? Because eating all these natural foods, he couldn't become overweight like that. You know, it's impossible to become overweight eating the right foods. The sign that you're eating the right diet is that your body will gravitate effortlessly without you having to count calories. And it'll take away your excessive hunger because the nutrients, the body senses nutrients coming through the digestive tract, and that turns off your drive to overeat. So fiber, the bulk, and the nutrient levels turn off your desire to overeat. Overeating, though, is based on food addiction. And there are two types of food addiction. One is the dopamine high that you get when you eat concentrated calories, and you get at the dopamine. You eat oil, and you eat a lot of sugar at one time, or you eat cheese, heavy concentrated calories, especially sweets. It puts a dopamine surge in the brain just like you're shooting up with a drug. It gives you that pleasure feeling in the brain, and you get addicted to it. You keep thinking about it. You can't get away from it. You want it. You're thinking about, oh, I got to go back and have my hit, have my soda, have my donut, have my cookie, have my candy. You get addicted. Overtakes the mind. How do you get rid of that? You don't eat those foods for a couple of weeks, and it's gone. The dopamine, and you don't even think about it. You just got to get off those foods for a few weeks. There's another type of food addiction. The other type of addiction is called detoxification or withdrawal. You've heard of that, right? When a person stops smoking, do they feel better or worse when they stop smoking? Of course, they feel worse for a few weeks. When you stop drinking, if you're drinking 10 cups of coffee a day, when you stop drinking coffee, do you feel better or worse? You feel like garbage. You're weak, you're tired, you're getting headaches. You're looking for that coffee. But in about 3 or 4 days, the headaches are gone. Here's the thing, that anything you take that's harmful to your body, it may make you feel better when you put the harmful substance in. The pain occurs, or the discomfort occurs, when you stop taking the harmful substance in, and the body tries to repair from the harmful substance and throw the toxins out. That's when you feel uncomfortable. And that's where people don't want to feel uncomfortable. The definition of the word addiction is that people feel discomfort when they try to stop doing something. So if you're looking to put as much weight on you as possible, you want to maintain addictions. You want to eat a lot of low-nutrient foods, and particularly scientists have determined, and the food manufacturers do this, they figure out how they can make lab animals grow and get obese as fat and make them want to overeat. Because they study this, because they want to make overeat, and restaurants and fast food manufacturers want to know what to put in their foods to make people want to eat more of it and buy more of it. And that's why they inject the French fry batter with sugar and salt inside the batter. They don't just put salt on the surface of the French fries. They put it in the middle so you can't taste it. So you get more salt in the body that you can't even taste. They even add sugar and salt into the burger, into the meat they grind up. Because they know if they can get you saltier and more thirsty, it'll make you drink more soda, it'll make you want to eat more. If they can put more oil, if they can get the fried oil to soak up the French fries, to be really soaking with a lot of extra calories, it'll drive you to keep overeating. That the secret formula to create obesity is sweeteners, oil, and salt, especially if you can mix them together in a meal. Like, like you take a sweet pancake, or you take, the American diet is like a cake diet, like a pancake diet. Everything's cake, right? They wake up in the morning and they have some kind of white bread. It's like a cake, or they have a pancake, a fried cake on the plan, right? And then they go to they have a cupcake, or they have a waffle as a piece of cake, or they have a, white bread or a pizza. What's pizza? That's a cake. It's a white bread cake with maybe some cheese on top. Or they have pasta. That's like cake. It's white flour. It's like it's just one white flour, one cake experience from meal to meal. It's a formula for incredibly bad health. So here's the point. We have to stop those foods. But the American population is doing the opposite of that. The American population is being invaded by fast food restaurants. The number one cause of death in firemen isn't fires, it's heart attacks, because they eat so much donuts. Some populations around the country, there's not even any supermarkets anymore. There's only fast food restaurants. People are buying their food in fast food restaurants. Look at West Oakland, California. They have one supermarket, 36 liquor stores, and 683 fast food restaurants. Unbelievable. You know, you have one cocaine death per 100,000 people there, but a 200% increased risk of death from prostate cancer, and a huge amount of increased risk of death from heart attacks. The more fast food restaurants there are, the worse people eat. Death rates go even higher than all the problems in America already are made even worse, because people are eating foods that put more toxins into the body and starving the body for nutrients. And when your body is toxic, when you're starved for nutrients, you rise free radicals up, you raise up advanced glycation end products called AGEs in the scientific literature. AGEs stand for advanced glycation end products, and they age us. They age us when we eat AGEs, and they form in the body when you don't take in high nutrient food, and cross-linking agents and lipofuscin and other toxins form in the cells, and we become toxic. And then when we try not to eat for a little bit of a period, we start to feel ill from the toxins that are built up in our body. So the toxins build up in the body, and then when we stop eating for just a few hours, when the digestive tract is not busy working to digest food, that's the time when the body can most effectively self-clean. That's the time when the body can most effectively repair and heal. And because it's in the repair and healing mode, you're going to feel ill as the body tries to detoxify and remove some of the buildup of toxins. And you're going to feel headachy and weak and stomach cramping and esophageal spasm and a growling stomach and irritable and moody. And most people think that that's hunger. They're not, and the medical books calls those symptoms hunger. It's all wrong. And one of my contributions to the field of nutritional science is the fact that I've discovered this, documented it, and published it in the scientific literature. And I did a study with more than 700 people to show that their perception of hunger changed, and they no longer felt those ill feelings once they ate a diet that was rich in micronutrients. I'll describe it more later. So your body, you eat a meal, and your glucose curve goes up. And that's called the anabolic phase of the digestive cycle. And that's like you're filling your car with gasoline. And then you drive the car away, and you finish digesting the meal, and you drive the car and you burn up the gasoline. Well, you finish digesting the meal, and now the body stored that glucose as glycogen. And that glycogen is broken back down again into glucose so you can utilize it to function, to live, to burn off those calories. And your brain, at rest, your brain utilizes 80% of those calories for energy, and the brain can only function on glucose. So the body takes the glucose in, utilizes part of that glucose for energy and for the brain's purposes. What it doesn't utilize after the meal, it stores as glycogen, and it's there for your use over a period of 3 to 6 hours after the meal to slowly utilize that glycogen, just like you're going to burn burn the gasoline off driving the car. You can burn off the glycogen you stored in the meal. That's how it's supposed to work. But it's not the way it works in America. Because people in the anabolic phase of the digestive cycle, that building phase, they eat, they enter the catabolic phase, just begin to enter when digestion ceases. They start the detox process in the catabolic phase, and they start to feel ill. So what do you think they do? They eat immediately. As soon as the anabolic phase ended and the catabolic phase started, they start eating again. They have to eat too frequently. They have to eat too often. They have to eat too much, lest they feel too ill. They've got to overeat to prevent themselves from feeling sick because they're so toxic, because they're not healthy, because they're not eating a diet that has a high enough nutrient per calorie density. It's flooding the body with nutrients, with the right nutrients, that wipes away the feeling, these ill feelings of shakiness and weakness, of headache and anxiety, making you think you have to keep eating food. So this slide is entitled, "The Pleasure of True Hunger," because what I'm saying here is once you're eating right, you enter the catabolic phase and you feel nothing. You no longer feel shaky and weak. You feel fine. You can do your work. You can function. You can enjoy your life. But then when you utilize that glycogen, when you burn it off 4 to 6 hours later, then instead of feeling sick, you feel true hunger. And true hunger is felt in the mouth and throat, and it's accompanied by dramatic, enhanced taste sensation. And that's when eating tastes the best. This pleasure of true hunger, the point here is that you're going to enjoy eating more, not less. You're going to want to eat when you're hungry because true hunger reflects the exact amount of calories your body requires to maintain your lean body mass, to maintain your muscle mass without any extra fat. You see, true hunger doesn't exist to put fat on your body. It only exists to protect your lean body mass. To have gained fat, you had to have eaten outside of the demands of true hunger due to recreational eating or to the need to eat due to addictive withdrawal from a poor diet. So when you're in that catabolic phase, that's the phase where the body heals and repairs. You want to live your body in that catabolic phase. You want to live as much as you can in that catabolic phase if you want to live as much as you can. If you want to live a long life, you want to extend your time in the catabolic phase. This is the opposite of telling people to eat frequently every few hours. That's information that will shorten lifespan. And that's information that's documented to cause weight gain, not weight loss. The amount of eating occasions correlates with excess calories at the end of the day, and it correlates with more weight, not less weight. The reason everybody advises that is because most people can't tolerate eating less often, because their diet's inadequate and because they're poisoned by excessive amount of animal protein. Because animal protein floods the body with so much nitrogenous waste products, so many waste products, that the extra waste products cause us to feel shaky and weak because we can't store nitrogenous wastes. We can't store the excess protein very well. So the body tries to eliminate it, and in doing so, we feel shaky and weak. And we eliminate it during the catabolic phase when we're not digesting food. Digesting food makes us feel better immediately, like drinking another cup of coffee does. Sure, feeling better is not getting better. Feeling better is getting sicker. Feeling worse is getting better. Hard to understand, I know that. But feeling worse is detoxing. So you're in the catabolic phase of the digestive cycle and you're feeling fine. If you continue not to eat, eventually the glycogen will go down. Your brain won't get enough glucose, right? No, wrong. Your brain will still get enough glucose because the body has another way it can make glucose other than breaking down glycogen. It can make glucose from breaking down muscle tissue to make glucose. The amino acids from muscle tissue can be converted into glucose to fuel the brain. And you can't make glucose from fat. You can only make glucose from glycogen or from amino acids from the muscle tissue. So do you think the body wants to break down its muscle tissue to fuel the brain's need for glucose? It doesn't, of course not. So when you get that signal of hunger, it's definitive. It makes food taste great and you feel it right here in your neck. Can't be denied. Now, it's not painful, it's not uncomfortable. If I get a call from a friend when I'm done with work and I'm ready to go home to eat and I'm hungry, he says, hey, you want to go play tennis? I'll say, sure, I'll play tennis. You start exercising, the hunger goes away. When you finish exercising, it comes back again. You don't have, but it makes food taste great. And I'll say again, living your life in that catabolic phase makes you live longer. You want to eat your dinner, finish it a few hours before bedtime, and have a fully extended period between 7 o'clock at night and 7 o'clock the next morning. At least 12 hours where no food's coming in, where your digestive tract is at rest. That's how you extend lifespan. Diets don't work. Diets of all description flood the marketplace. And every year there'll be hundreds of new diet books coming out. And it'll all be some gimmick or trick, and one will be popular and one will be more popular than another. But this concept of eating for health, eating for micronutrients, and eating to lower your hunger drive and get rid of food addiction will never change. It will never go out of style. You know, people can't lose weight and they gain the weight back because it's like telling them to breathe less oxygen because their body's demanding more calories when their micronutrient needs aren't being met. The body doesn't feel well on less calories. It has to keep the digestive tract going all the time. So any weight loss, they're struggling all the time. How long can you stay denying the physical sensations of the body telling you to eat more? You can't. What you have to do is remove them. The only way to get rid of the signals in the body that are telling you to eat more is to eat healthy, is to eat the right nutrients, is to seek volume, food volume, and food nutrients. And don't forget, too much animal protein, too much sugar, sweets, and caffeine could feed toxic hunger. The problem with coffee and caffeine is it can disconnect you from feeling hunger because you'll feel withdrawal and headachy and a little shaky, and you'll think you'll have to eat. It will not give you the ability to sense when you're really hungry. And I want you to feel that so you can direct yourself to the exact amount of calories you need so your weight never goes up and down. You stay at the stable weight your whole life. True hunger is a blessing. It feels great. It's in your throat. It's accompanied by increased salivation and by heightened taste sensation. And when you're hungry, it's the right time to eat. You're not overeating. And you know what? If you eat a little too much or a little too little, doesn't matter. You don't have to eat the right amount. You know why? Because the body won't get hungry till it's the right time for you to eat again. And if you ate a little extra at dinner, you won't be hungry at breakfast. And you'll eat a later breakfast. If you ate a little too much so in other words, your body is a fine computer. And over a week's time, it'll average out within 25 calories a day, the right amount of calories for you to eat, if you let your body's natural computer work properly. You know, Americans are so sick, they have to eat all the time, or you know what they can do? They can eat a big meal with so many calories and such difficult to digest food, like meat and cheese and sauces and all this rich food, that they can keep their digestive tract busy for a full 5 hours till it's time for them to have another rich meal. Or they can eat a lighter meal and keep eating, but they can't tolerate not having the stomach being busy. You shouldn't need to have your stomach being busy. And people like you, like me, regular people who felt they tried to lose weight and they gave up, they threw in the towel. They're never trying a diet again because it's not going to work for them anyway. They struggled. But these people have lost 100 pounds, 200 pounds, 50 pounds, gotten their health back. They had the same feelings you had. But when they learned this information, they tried it. It worked. They enjoyed food more, not less. They got rid of their food addictions. Without addressing the addictive nature of unhealthy food, they weren't going to succeed on any diet style. And here I did a study where I tracked and surveyed 768 participants following a high nutrient density diet. And 90% of them who followed the diet, 90% or greater, reported this changed perception of hunger that occurred over the first 6 months. Stick with it. This is something that's really important. So they lost their addictive drive to overeat. They no longer want to overeat. They enjoy eating better tasting food. They enjoy eating food more, not less. So here's my nutritarian prescription for you. What I want you to eat every day to flood your body with nutrients. Here's the starting point. The things you have to do to start to get rid of your drive to overeat. Check these off. Are you doing them or not? Number one, eat at least a half a cup of beans every day. Do you eat some beans every day? You should. I want you to. Check that off. It's important. Eat at least 3 fresh fruits a day. Do you eat at least a cup of berries and 2 other fruits a day? Are you having 3 fresh fruits a day? You've got to check that off. It's one thing you have to do. It's part of the formula here. Eat at least 1 ounce of raw nuts and seeds a day. And out of that 1 ounce of raw nuts and seeds, I want I want at least a tablespoon of chia seeds or sesame seeds or flax seeds or hemp seeds. I want at least a tablespoon of those seeds to get the lignans you need. I want some of those nuts and seeds to be some walnuts if possible for the omega-3 fatty acids. Have all the seeds and nuts you want, have the types you want, but have some of the hemp, chia, flax, or some walnuts for those omega-3 fatty acids, and then have some other nuts and seeds, pistachio nuts, pecans, whatever you want. I'm going to give you incredibly great recipe ideas for this too. Have at least 1 large salad every day. 1 big salad. I want a sign on your refrigerator that says the salad is the main dish. Take out a marker, make a nice sign, and at least at one of the meal, make the salads the main dish. A big salad. Chop up the lettuce and the cabbage and the tomatoes and the red onion. Put a delicious nut-based dressing on it. Make a delicious tasting salad. Kiwis or strawberries or cherry tomatoes or sun-dried tomatoes in there. Make a roasted garlic dressing. One of my favorite dressings has roasted garlic, almonds, whipped up a little tomato sauce and a little fig vinegar or balsamic vinegar, whipped up, tastes fantastic on a salad. A little bit of dark vinegar with the almonds. And tomato sauce, sometimes chopped Sundered tomatoes. I'll take a whole bulb of garlic, cut the bottom off, roast in the oven for 10 minutes, squeeze out the roasted garlic, mix it in the blender with my dressing. It's a delicious tasting dressing. Okay, so have at least one nice salad every day, and then half a cup of beans, you could dump it right on top of the salad if you want. Have at least one double-sized portion, maybe at night. Maybe you're having soup and a salad with lunch and a big serving of greens and a fruit bowl for dinner, or, or a small salad for dinner. But have a serving, maybe with mushrooms, of some green vegetable, like asparagus, like broccoli, cabbage, artichokes, string beans, broccoli. Have a nice serving of cooked greens every day. And don't forget, check off on your list, have some mushrooms or onions every day. Your goal is to have a half a cup of onions a day, and mushrooms, you just need a little bit. Just a small amount every day. Just have some every day on a regular basis. They're tremendously protective. So what happens when you do this? Take a look at Scott. He was over 500 pounds, having tried every diet out there. Nothing worked for him because he was a food addict. And until it was explained to him how to remove his addictions, he wasn't going to succeed. So many people just like Scott. And Scott was over 500 pounds, and then he lost over 300 pounds. And you know what? The weight he achieved, he thought he achieved his ideal weight. He wasn't trying to lose any more, but he kept losing a little more just because he's not dieting. He's just eating for health and doing what comes naturally. And that's where he says, I'm not on a diet. I'm just eating for health. I didn't have a goal weight. I just took care of my health, and that's what happened. So it's what does happen. Adriana, the same thing happened to her. She was obese her whole life, even as a teenager. In 1 year, she lost 120 pounds. That's averaging 10 pounds a month. Fantastic, especially for a person who's tried every diet out there in the world and couldn't lose weight before, to drop 10 pounds a month and keep losing for the whole year and continuing to lose weight after that too, obviously, because she's now taking care of her health. And the results that these people are getting give them positive reinforcement because they feel good. They have their energy back. They're not on a diet. They're eating large amounts of food. The recipes taste fantastic. They're enjoying what they're eating. They're not on some crazy fad diet that they know is not good for them. They know it's good for them, too. Emotionally, intellectually, psychologically, they know it's the right thing, and that helps you. Teresa, she lost over 100 pounds. How did she do it? She ready to live, and she said, I'm going to protect my health future. I'm getting close to being pre-diabetic. I have headaches. I have sinus infections. So take a look at these statistics here. She went from 227 to 125. Of course, she dropped like 18 dress sizes. Her cholesterol went from 227 to 172. That's total cholesterol. Her LDL went from 148 to 98. Her waist went from 40 inches to 26.5. Her blood pressure went from high to low, or to normal actually, 112/66. And she tried all those other diets in the past. But you know, sometimes there's something that clicks in your head that wakes you up. Could be a family history that you're going to know you're going to have. Your parent could have some medical tragedy happen to them. A friend. You could finally be woken up by a doctor telling you have high cholesterol, high blood pressure at a young age. But you know what? You don't have to wait till it happens to a wake-up call, because sometimes that wake-up call could be too late. You want to have it happen before something bad happens to you. Now, luckily, here's Bill. Bill also lost a huge amount of weight. He dropped over 100 pounds, and he was a long-term food addict. He had to solve his food addiction problem before he could lose the weight. At 268 pounds, he didn't even see himself as being overweight. You know, you kind of like rationalize when you're an addict, when you're a smoker, you come up with rationalizations. You say, you know, I smoke cigarettes, but it's not the right time for me to quit. It's not going to be so bad. Maybe I use organic cigarettes. You always have some reason, or I'll wait till I get pregnant, or I'll wait till it's too stressful for me right now. My husband might be losing his job. My son smashed the car. I'm going too much stress at work. I'll quit smoking sometime in the future. You know, you don't wait. That's the primitive part of the brain, the addictive part of the self talking to yourself. The addictive part of the brain is protecting you against the anxiety that occurs with change. And I know some of you out there listening to me right now are thinking to yourselves, this sounds really good, but I am a food addict, and I'm not sure I can do this, and I'm not sure I can change. And you know, you can. And it is uncomfortable to change. And change is scary. and it creates anxiety. And your brain may be coming up with rationalizations why you should not do it. Don't do that anymore. Quit. Make a decision. Make a commitment. A commitment is not trying. Don't say you're going to give it a try. Saying you're going to give it a try means I'm going to be waiting for an excuse so I can go back to my old way of eating. There's no excuses. When you got married, did you say to the person performing the ceremony, did you say, you know what, I'll give it a try, but the first little thing that bothers me, I'm running away. That's what give it a try. No, you made a commitment. Your life is too important. This is one of the most important decisions you can ever make in your whole life. And you got to make the right decision here. And that means you got to make the right decision like Bill, like Teresa, like Ronnie, like Emily, like Adrian, like Anthony. You got to make the right decision. You got to save your life because you never know what's going to happen. You never know. You could have a heart attack next week. Do it now. Don't wait till it's too late. I want you to eat a nutritarian diet, a vegetable-based diet. It's vegetable-based with lots of greens, beans, seeds, nuts, fruits. Oil, use sparingly or not at all. Animal products, use sparingly or not at all. Focused on nutrient-dense calories. The standard diet is the opposite. It's a grain-based diet focused on processed foods and flour. There's lots of dairy, meat, oil supply, a major caloric load. The average American's eating 400 calories a day from oil. You can't lose weight doing what the average American does. If you do the American diet, you get what Americans get. They all become overweight. You know what? 90% of Americans are overweight, 90%. The 10% that are of a normal weight, let's figure this out. More than 10% of the population are depressed, smoke cigarettes, or have digestive disorders, have an autoimmune disease, have depression, have some medical reason why they're a normal weight. The point I'm making here is that if you're normal and you're eating American food, you become overweight and you have things happen to you that are tragic. You can't do what other Americans do. That's not the right choice. That's an ignorant choice. It's a choice based on addictions. It's a choice based on pressure. It's a choice based on misinformation. We have to make sure you make the right decision for your life. I'm wishing the best for you. I'm hoping you make the right decision. I'm hoping you live your life free of diseases as long as you could possibly live life. And when you do it that way, it doesn't get perfect right away. It doesn't happen without any effort. It takes some effort to achieve a really good life. Because when you start out, you're a white belt. And that means you're feeling shaky. And you try to eat healthy and you feel worse. You don't feel better. It's only happened for the first week, maybe only the first 4 days, where you start to feel maybe a sore throat or a headachy or a fatigued. And then that goes away. And then you're an orange belt or a green or blue belt. You feel better. You're not going to in a couple of weeks, you're still going to crave maybe the foods you're missing. It's not going to go away, your desire to eat unhealthy food. That takes more time, though. But you're feeling good, and you're seeing the weight come off you, and you're breathing better and getting energy back. And then you become a brown belt. And you're doing it for months now. And you start to be able to feel true hunger. And you realize how pleasurable it is to eat when you're really hungry. So don't overeat. Eat right. Err on the side of caution. Don't eat till you're full or stuffed. Stop before you feel distended or full. You can eat again when you get hungry again. You're eating as much food as you want. We have an abundance of food in this country. And because you desire less food and you require less food, your food bill goes down. You can spend it on food quality, not on food quantity. You can eat great tasting, healthy food, but you're going to be eating less food because you're not going to want as much food. And then you become a black belt. And then you're doing this 8 months, 10 months, 12 months. You lost 80 pounds. You're feeling great. You no longer have medication needs. Never going to be on blood pressure medications. Never going to be on cholesterol-lowering drugs. You're going to feel great. And you figure, you know what? I lost weight. I'm in great shape now. It's my birthday. Why not splurge? I'll go to a restaurant. I'll have some barbecued ribs, cheeseburgers, cheesecake, ice cream on top. You know what happens? Well, you're not going to tolerate that anymore. Your body's too clean, too healthy. You're going to start to eat that stuff. Number one, you're not going to like it anymore. You're going to taste it and you're going to go, you're going to go like, it's so salty, it's so greasy. How did I like this stuff? You have this emotional attachment in your mind thinking you used to like it, but your taste buds changed. You're saying, I prefer the food I'm eating now. I don't even like it. And you're in that, and then you wake up with stomach aches all night long, and you're on the toilet bowl all night. You lost 3 pounds. You just about, and you'd have a dry mouth, drinking like crazy. You realized you like the salad with the fresh figs and the nice dressing, and you know you like the right kind of foods made with delicious recipes. Your taste buds change. They adapt to this new way of eating. It becomes the way you prefer to eat. You get married, and you like the marriage. You enjoy it. You're happy. You're feeling good. And it's the way it just becomes natural. So what makes this unique? Pretty simple. Nutrient per calorie density is important for devising the right kind of diet. It helps direct you to the right foods for your health, your longevity, and your weight. Number 2, low nutrient eating leads to toxic hunger, leads to toxic addictive drive to overeat. You have to eat right because it'll can reconnect you with the right amount of calories without having to measure food and ever diet again. You eat like you feel like eating, but you only feel like eating the right amount of food from then on. Multiple factors affect your drive to overeat, right? Volume, nutrient density, emotional and recreational eating. You become the nutritional expert. This program makes you the PhD in human nutrition. You're in control of your health, and you're in control of your life now. Assuming nutritional excellence means meeting your nutritional needs. And that's what you should be striving for. It's one of the most important things in life is to protect your health. I'm wishing you tremendous success, all the best life has to offer, and you can achieve it. Please send me your results. I'll be rooting for you. Take care.